All right. Good morning.
Morning.
Morning, everybody. Welcome to the May 8th, 2026 California Board of Behavioral Sciences meeting. My name is Nick Boyd, Vice Chair of the Board. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing the board's laws. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. The Board of Behavioral Sciences will be holding this public meeting in person and via the WebEx platform. I will announce when we are accepting public comments on the various issues. For each public comment period, we will first be accepting comments from the participants in the audience present in the room. Then the moderator will open the lines as appropriate so that the remote audience members can comment. Each commenter will have 2 minutes to comment. Moderator, would you please provide the audience with instructions on how they may participate during the meeting at the appropriate times?
Thank you, Mr. Chair. For those logged into WebEx, I just want to remind you to please remain muted unless you're speaking to protect the sound quality of the meeting. When it comes time for public comment, we will take public comment from the room at the physical location, followed by WebEx. You may indicate that you would like to make a comment by clicking on the hand icon next to your name to raise your hand. For those calling in to the WebEx meeting, you may raise your hand by pressing *3. And we will be displaying the instructions that we're displaying right now at that time. With that, I return the floor back to you, Mr. Chair.
Thank you very much. Before we start today, I would like to note that we will not be discussing agenda item 28H today. Additionally, after establishing quorum and introductions, we will begin our meeting today with agenda item 9. Lastly, because we have a very full agenda, I'd like to ask everyone to help keep the meeting moving along. Thank you very much. I think we are ready to do quorum. So members, during the roll call, please introduce yourself and let the public know whether you are a public or a licensed member. Rachel, can you please help us establish quorum?
Of course. Dr. Nicholas Boyd.
Present.
Susan Friedman.
Present.
John Sovic.
Present. LMFT, pronouns he, him.
Rebecca Thies.
Present. Public member, pronoun she, her.
Eleanor Uribe.
Present. LCSW member.
Dr. Annette Walker.
Present. Public board member, pronouns she, her.
Kelly Ronasinki.
Present public member, pronouns he, him.
And for the record, Wendy Strack, Lorez Bailey, Justin Huft, and Christopher Jones are absent today. We have a quorum.
Great. Thank you so much, Rachel. And I should have read my own instructions, and I'm a public member, a licensed member, LPCC. Thank you. So additionally, we'll be taking a lunch break as close as we can to 11:30. But as mentioned, we have a pretty full agenda, so it will really depend on where we end up this morning. So before staff introduce themselves, I would like to note that we have a new legal representation.
Oh, sorry. You already have that.
We already did that, right?
I apologize.
Great.
Let's scrap that.
Okay. Board staff, would you please introduce yourself?
Steve Sodergren, Executive Officer.
Marlon McManus, Assistant Executive Officer.
Shelley Ganaway, Board Counsel.
Roseanne Helms, Legislative Manager for the board.
Christy Berger, Regulatory Manager for the board.
Sarita Risso, Special Projects and Research Analyst for the board.
Rachel Lanzoni, Budget Analyst for the board, filling in for Christina Kitamura.
Great. Thank you so much. Now is the time for the public to introduce themselves if they would like. This is voluntary. Is there anyone in the audience that would like to introduce themselves?
Good morning. My name is Shanti Ezra, and I'm the State Government Affairs Associate with the California Association of Marriage and Family Therapists.
Okay, good morning. Bindu Mukamla, Policy Manager with the National Association of Social Workers, California chapter.
I'm sorry, you're muted. The microphone's muted.
If you could press the button.
You see a little green light.
My name is Evelyn Beauchamp. I'm a licensed clinical social worker, and I'm also the social work occupational chair for AFSCME.
Thank you. Are there any introductions online?
Yes, we have a number of raised hands. Start with Ben Caldwell. Ben, you should see a prompt to unmute. Go ahead and click on it.
Good morning. Thank you, everyone. Ben Caldwell, licensed MFT with High Pass Education. I regret that I will not be able to be in attendance for most of the day today, but Rachel Cipollone is here from my team and will be able to speak for me in my absence. Thank you.
All right, next we have Sarah Carrasco. Sarah, you should see a prompt to unmute.
Good morning, Sarah Carrasco, Licensure and Compliance Specialist with William Jessup University. Happy to be here.
All right, and next we have Kathy Atkins. Kathy, you should see prompt to mute yourself.
Good morning, everyone. This is Kathy Atkins, Deputy Executive Director of the California Association of Marriage and Family Therapists. Thanks for having me.
Next we have Eric Hernandez.
Eric Hernandez, licensed clinical social worker, AFSCME Local 2620.
And then we have Cassandra Clayton.
Good morning, Cassandra Clayton, licensed clinical social worker with the California Department of Corrections and Rehabilitation, and I'm with CCHCS Healthcare.
And then we have Lois.
Hello, my name is Lois Poffbergen. I'm the Executive Director of the Association of Marital and Family Therapy Regulatory Boards.
All right, this is a moderator. I see no more raised hands. I return the floor back to you.
Great. Thank you so much, moderator. So next on the agenda is discussion and possible approval of the November 2025 board meeting minutes. Does any member wish to remove or edit any items from the consent calendar? No? Okay. If not, do I have an motion to approve the consent calendar?
Dr. Walker, Public Board Member, I'd like to make a motion to approve the February 19th, February 19th, is that right? February 19th through the 20th, 2026 board meeting minutes.
John Sovek, second.
All right, we have a second. Sorry about that. It should have been February. Thank you for the correction. I said November. Thank you for that. So we have a second. Are there any comments from our in-house audience participants? Are there any comments from our online audience participants?
Thank you, Mr. Chair. If any member of the audience would like to comment on agenda item 9, please raise your hand by clicking on the hand icon next to your name, or if you've called in, pressing star 3. We are displaying instructions and we'll give you a moment. All right, I see no raised hands. I return the floor back to you.
Great, thank you. So next on the agenda is, oh, I'm so sorry. Thank you. Rachel, could you please help us take a vote?
Of course. Kelly Ranasinghe,
Yes.
Dr. Annette Walker,
Yes.
Eleanor Aribe,
Yes.
Rebecca Thies,
Yes.
John Sovik,
Yes.
Susan Friedman,
Yes.
and Dr. Nicholas Boyd.
Yes,
Motion carries.
thank you. Okay, so next on the agenda is the discussion and possible action to make recommendations of the information bulletin on education and continuing education opportunities in perinatal mental health. Steve, would you please provide us with an overview?
Yes, thank you. I will. Just to give you a little background on where this is coming, what gave us the idea for this informational bulletin. In 2024, two bills were signed into law, AB 2270 and AB 2581, and that requires the Board of Behavioral Sciences to consider including a course in menopausal mental health and a course in maternal mental health as respectively as part of the continuing education requirements for license renewal. During the November 2025 meeting, the board recognized the importance of maternal and menopausal mental health, but expressed caution about mandating continuing education in the subject area. The board affirmed its direction to refer the matter to the Workforce Development Committee for consideration as a broader CE and education review for the education review process, and to the Outreach and Education Committee to explore near-term outreach efforts. And this is where the information bulletin has come into play. And we discussed the informational bulletin that's in the packet at the Outreach and Education Committee. It got full approval to move forward, and we wanted to make sure that the board had a chance to see this. We would like to we collaborated with Elise Springer, who represents the California chapter of Postpartum Support International, and she was a great resource for that. In just a kind of a note, we started off with the term maternal mental health, but a more proper term is perinatal mental health. So that has kind of changed. It's a more encompassing term. So this bulletin, what it does, it outlines common clinical issues and the importance of competency in this area for board licensees. It also provides a list of resources for further education and training in the subject. And so it's kind of timely too that Jennifer Siebel Newsom just joined the California Leaders on Perinatal Mental Health and put out a bulletin just this week about perinatal mental health and the importance of it. So this is somewhat timely. So really, just if there's any discussion on this, if anybody has any additional items that they want to add, or if there's corrections, I would discuss and then make a motion to make any suggested changes, and the staff will then work to finalize this document and utilize it, not just the document alone and posting it on our website, but using it for also social media alerts and such. So to keep it active and in the public's eye. So, yes. Go ahead.
Great. Are there any comments or questions from committee members?
Yes, thank you so much, Steve, for bringing this to the meeting today. We did have an extensive, very lively and engaging discussion around this matter in the Outreach and Education meeting, and the timeliness of you bringing this forward is just right on point. So I really appreciate that. And based on your last comment, I feel like you're in my head already this morning. But when I was reading through the publication, I could so see an infogram or infographic, if you will. And I'm thinking of Tony with our social media. I could so see this being disseminated in a very visual, pleasing manner, if you will. So just using that mechanism, if you will, would just be awesome. So thank you for bringing this forth. And just being who I am, we do want to edit your memo there with getting the correct date there. November 2025.
Oh, yeah.
I mean, love that play on numbers there, but that's, yeah. And that's all I have, but thanks again.
Thank you. Any other questions or comments from the committee or the board members? Okay, are there any comments from the public?
Good morning again. My name is Shanti Ezrin with CAMPT. Wanted to acknowledge just the importance of these perinatal topics and that we're very supportive of efforts to encourage training and awareness in these areas. While we're generally opposed to specific CE course mandates, we're very grateful to see staff working with stakeholders to develop these informational resources to support further education and training. And CAMPT is very happy to share out the bulletin once it's published. Thank you.
Any other comments from the public? Any comments from remote participants?
Thank you, Mr. Chair. We do have some raised hands, beginning with Maria Fuenzalida. Forgive me if I mispronounced your name. Maria, you should see a prompt to unmute. And Maria, I'll try sending that prompt to you one more time. If you see a prompt to unmute, go ahead and click on it. All right, what looks like Maria is having difficulty unmuting herself. What I can do is temporarily.
I think I got it. Are you able to hear me?
Yes, please go ahead.
Perfect, thank you. All right, good morning, and thank you for the opportunity to speak today. My name is Maria Fuenzalida, and I'm a bilingual licensed clinical social worker in the state of California. I am also a certified perinatal mental health provider and a board member at Postpartum Support International's California chapter. I am here to strongly support requiring all licensed mental health clinicians in California to receive foundational training in perinatal mental health. These conditions are not rare. They are the most common complication of pregnancy and childbirth. They are much more common than gestational diabetes or preeclampsia. And research estimates that up to 1 in 5 pregnant and postpartum individuals will experience a perinatal mental health disorder. As a bilingual clinician, I could say that number is probably much higher because communities like mine don't often report these things. These conditions, as you may know, include depression, anxiety, OCD, PTSD, bipolar disorders, substance use, and postpartum psychosis, to name a few. Yet many clinicians graduate with little or no formal education in recognizing or treating this condition. I believe this is not a quality of care issue. It is a public health and safety issue. In California, suicide and overdose have been identified as leading causes of maternal death in the postpartum period. Many of these deaths are preventable with early identification, appropriate referral, and competent mental health intervention. I think every licensed clinician, regardless of specialty, is likely to encounter pregnant or postpartum clients in their work. You do not need to specialize in perinatal mental health training to recognize warning signs, screen appropriately, understand risk factors, and know when a higher level of care is necessary. California has been a national leader in maternal health innovation, and we now have the opportunity to lead again by ensuring that every mental health professional has at least basic competency in perinatal mental health care. I do believe lives can be saved, and the generational impact would be huge if postpartum clients receive the support they need, regardless of where they access.
15 seconds.
I respectfully urge the board to support mandatory foundational perinatal mental health training for all licensed mental health professionals in California. Thank you for your time.
All right, and the next comment is from Elise Springer. Elise, you should see a prompt to unmute.
Good morning. Am I coming through?
Yes.
Great. Thank you so much. Good morning. My name is Elise Springer, and I'm here on behalf of the California chapter of Postpartum Support International in support of approving the informational bulletin on perinatal mental health. I would like to sincerely thank the staff and the board for bringing this forward. The bulletin appropriately recognizes the perinatal period as a distinct developmental interval involving biological, psychological, relational, and social transition. It also acknowledges that these conditions affect not only birthing parents, but fathers, partners, adoptive parents, children, and diverse family systems. This bulletin does help communicate that perinatal mental health is not niche or rare. These conditions, as you've heard, are the most common complication, and untreated perinatal mental health carries serious consequences for parents, infants, and families. If you have been born, you have experienced the downstream impact of perinatal mental health, whether through attachment, caregiving, trauma exposure, family functioning, or relational help. I also want to respectfully acknowledge that this is a beginning, not an endpoint. A bulletin is a meaningful step for awareness and culture change, but ultimately it is a Band-Aid, not a systems level fix. California has already operationalized perinatal mental health across systems through initiatives like the Birth and Care Pathway, CalAIM, screening expectations legislated into law, referral pathways, and population health efforts. Clinicians across the healing arts are increasingly being asked to engage with a statewide system of care that they have not fundamentally been trained to work within during pre or post licensure. Right now, providers are expected to screen and treat across pregnancy through the first year postpartum, and the perinatal
15
period
seconds.
still does not have equitable standing in foundational behavioral health training alongside other required domains. I request the board to vote yes today, and I hope this momentum continues into longer-term workforce conversations around upstream education and baseline competency. Thank you again for your leadership and consideration.
All right, this is a moderator. I see no further requests for comment. I return the floor back to you.
Great. Thank you so much. Thank you, Steve. But do we need to take a? Okay.
Yeah.
Yes. So we do need to take a motion. So I think our motion is to direct staff to make any discussed changes and proceed to the publication of the bulletin. Is that correct? Okay.
Sorry, we didn't catch any of that.
Yeah, I'm sorry. I'm leaning here a little closer. So the motion would be to direct staff to make any discussed changes and proceed to publication of the bulletin.
I believe it looks pretty good, so I'll make a motion to accept staff's recommendation at this time.
I'll second the motion.
Shelley, should we go out for opinions again?
We have to go
Yeah,
back
okay.
out now.
Okay, are there any comments from the public? Audiences in the room? Moderator, are there any further comments from those attending online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name. Or if you've called in, you may press *3. We are displaying instructions, and I do see a raised hand. Elise Springer, let me go ahead and give you the prompt to unmute, and go ahead and click on it when you see it.
Hello again. Thank you so much. I am a little confused. So just wanting to clarify that the bulletin, the motion is to publish the bulletin, or the motion is to correct any staff changes. Thank you.
The motion is published, but with the correction of the date, which is consistent with the discussion. So it will change to 2025 instead of that technical error.
This is a moderator. I see no further requests for comment. I return the floor back to you.
Okay, great. Rachel, can you help us with the vote?
Of course. Rebecca Thies,
Yes.
John Sovic,
Yes.
Eleanor Aribe,
Yes.
Dr. Annette Walker,
Yes.
Kelly Ranasinghe,
Yes.
Susan Friedman,
Yes.
Dr. Nicholas Boyd.
Yes.
Motion carries.
Okay, so moving on to item number 11, discussion and possible action to approve the 2026-2030 strategic plan. Steve, would you provide us with an overview, please?
Yes, good morning. Our last meeting in February 2026, Solid Department of Consumer Affairs Solid unit guided us through the last process of the strategic planning that began, I guess, about a year or so ago with the environmental scan and such. So what they were going through is an open discussion about some of the goals and objectives that we had identified and staff had worked on to identify. And here we are with the draft. We've gone through, just to note, since then, Solid has been working on kind of refining the strategic plan. You will notice we had a much more objectives in that we discussed in the February meeting. Looking at the objectives, we had quite a few objectives. And so we contemplated on some of those objectives addressed before really would turn into what is called a task item, actual work for the board staff to do. So when we move forward looking at the strategic plan, just take in mind that these objectives are very broad, and some of the things that you may have identified earlier, we did not just dismiss them. They will be included in those objectives. From here, what we're really going to be looking at is approving this draft, and then after it gets approved, we will go back with Solid, the staff management. We'll go back with Solid and have sessions to really lay out the task items within each of those objectives. And the goal is to report to the board on, I guess it will be hopefully in August, we would have this done if it's approved today, with a full kind of strategic plan with objectives and the tasks. And from there on, I know we look at the strategic plan at every board meeting, but maybe we could focus a little bit more on it. And I can really would like us to, at least for in August or the next meeting when we have that full strategic plan, to really look at the task items that staff have identified and make sure there's nothing in there that there's that's all comprehensive, or if there's items that you would want to add or suggest. Additionally to a lot of this work, we will be using the strategic plan for each committee meeting. That will really be where a committee can really focus on refining the tasks to reach those objectives. I plan to make this more of a focus and more reporting for the board in the future so that we can really keep our eyes on this. So with that being said, in the material is the proposed strategic plan, and I would hopefully had a chance to review it, and I'm up for questions or comments.
Great. Thank you, Steve. Are there any comments or questions from the committee?
John Sovek. Steve, in looking at goal number 3, examination, and then looking at objective 3.3, I'm reading it and I am not sure exactly what you're trying to communicate with what was written.
So improve exam information and so 3.3 is improve exam. So goal 3 is administer fair, valid, comprehensive, culturally responsive, and relevant licensing examinations. And the goal objective 3.3 is improve exam information and resources to establish expectations and assist applicants through the exam process. It fits within an exam. It's somewhat as if you relate it to the goal. I think maybe the goal should administer fair, and maybe there needs to be an added to that. But what we're talking about is making sure that exam candidate has as much information as possible before heading into the exam, so they know what should be expected of them or what the exam is going to be asking for, to just assist everyone and make those resources accessible. And maybe if we had resources where a lot of people use test prep programs, but some people can't afford that, is making more material available for people when they take the exam.
And so that's how you're going to build the exam goals, task items underneath that then? That's
Yeah.
what, okay.
Yeah.
Because when I read this, that's not exactly what that says. So if I could just encourage you to look at the wording of 3.3 and align it with what you just spoke, because it's a little bit fuzzy in the way it's written right now, and it doesn't align with what you just said.
How, yeah.
So how do we improve exam information? What is that? What is
That's
that?
what I'm thinking, maybe taking that out and improve resources to assist candidates in understanding testing expectations, and to that matter. I think the exam information is kind of
right.
Yeah.
Okay.
What about
improve access to exam information and resources?
Oh, there we go.
Because we're looking at the information is like when I was taking my test, I go online, I find that little brochure that says, here are 10 test questions. Wow, see, here's how you sign up. Like all of that's there. That might help a little bit addressing that.
I think that's more succinct and really what kind of captures that. That's,
okay.
Yeah.
Okay.
Any other comments, questions? Okay.
Then I'm going to step in again. So Steve and I have been having an ongoing conversation, both in email and online, about something that I had talked about at our last meeting. And it is about putting into our strategic plan something to address basically the concerns that so many of us in the community are having right now about marginalized communities, trying to access care, and I know I'm on the record, so I'm trying to be very careful with what I say here. And the lack of security and access to records to people from certain communities. I was very direct in asking us to put that in here. You shared with me some of the responses from legal as to why these things couldn't happen in certain ways. But the more I think about it, the more I'm really concerned that it doesn't really show thematically up almost anywhere in our strategic goals. And I think in the world we live in right now, we need to find ways to keep clinicians safe and clients safe and all of their confidential records. I do believe that we actually need to maybe search a little bit deeper to find a way to state that somewhere in these strategic goals, or I think we're not serving the communities that we say we're supposed to be serving.
Thank you, John.
Dr. Annette Walker, public member, I totally appreciate Board Member Sovek's comments. And I'm reading in between the lines because I wasn't in the conversation with Steve, John, and legal. But it would appear to me, if you will, that the language that we're trying to be inclusive with as far as safety and protection, there must be legalese where we can get this in a very kind, gentle way, but that's very direct and appropriate. So thank you.
Some of the issue is that there's already existing laws on confidentiality. There's already existing laws on how things can be stored. AI is ever changing at this point. There's about, I want to say, 5 to 7 bills that are going in right now. So we don't want to have anything that is more restrictive than the current law. And we also don't want to be in a position where we're stating or telling licensees how to interpret the law. Okay, so our job is we can point to where the law is, and then the licensee can interpret. It's very fact specific. So that was the kind of the conversation that I had with Steve about it. Is everything is very different. Like a subpoena could be so many different kinds of subpoenas that you could receive. And so we have to err on the side of caution so that we are not imposed or so that we are cautious in that we are ensuring that we're not opening the board up for liability, particularly in giving legal advice, because that's not our position.
100%. And I appreciate what you're saying. And let's keep in mind where we're looking at where this will live. We're looking at our strategic plan, which is a live document, which is available to the public. So I understand what you're saying about directing them to the law and providing resources, which, you know, our stakeholders are so generous with us. So, but we're looking at the strategic plan and language according to Mr. Sovek's comments. So what you just said, how you do that and where you would plant that in this document, I would love to see come back. I get what you're saying though.
And if you have a
even if you're referencing certain laws.
and you're also, if you're referencing what section that you would like to discuss specifically, John, and where you would like that to be added, and Dr. Walker as well. Yeah, go ahead.
I'm not to butt in. Sorry, I apologize for being rude there. I did have a suggestion too. Is there are ways that we can definitely fit these within the tasks and even get more specific tasks. Since you said like it is a working document, like in workforce, the Outreach and Education Committee, we are looking at a document, just an informational bulletin right now on working with marginalized communities and such. That's one thing, but we can also put on like a task list to make sure that we are looking at legislation that does support the strengthening of confidentialities and laws, or look at ideas to put out more guidance documents on more specific, more specific touch points that we really should be looking at. Not necessarily interpreting the law, but giving more information about certain specifics. The one we're working on right now is very broad, and there's a lot more details that we could probably hit, but laying that out as a task and actual specific tasks, like let's look at this, and then we can work on that. And then additionally, I'm sure there's going to be legislation and continually looking at these the aspects of what we're looking at here. So definitely keeping sure that we keep an eye on those confidentiality, legislation that goes through with any of those laws. Any of those.
I'm going to move this on, but I appreciate your suggestion. And just for the public and everyone that's looking at this document right now, what you said is very important. There's a second layer to this where we include tasks and things like that. We're not looking at that right now, but as again, Mr. Sovek suggested in 3.3, if we add the word access, and then they go to the working document, I don't know how we're going to post that.
It will be, it's posted, it'll be shared. The strategic plan will have the objectives and the goals, but at our board meeting, the board meetings will have the tasks and
Wonderful.
everything presented.
Thank you.
So.
Kelly, I see you up there.
Yes, I also agree with Board Member Sovek's comments, particularly that our primary goal is public protection, and members of vulnerable communities, including those in my community, are also members who seek mental health services, in fact, more so than the general population. And it's very necessary for the board to communicate that the safeguarding of confidential information for those vulnerable populations is a matter of regulatory protection. And sorry, I'm really sick, but if that is not included in the strategic plan, I would very much support it being included in a specific outcome or task item. And further, I'd also include, I would suggest that we include it in a resolution to make it abundantly clear that the confidential information of vulnerable populations who seek mental health counseling in California is a subject of public protection.
Thank you, Kelly. Are there any other comments or questions, John?
He may be sick, but he's still brilliant. Thanks, Kelly. So as I'm hearing this conversation open up again, I think the misinterpretation that we've hit a wall with is that somehow the suggestion is that we're making legal strategies or giving people legal advice on this. What I'm actually inviting us to do is make it a part of our strategic plan, which is for the next 4 years.
4 years.
Okay? That we are purposefully making a statement that these are goals that we want to bring into the forefront. Once again, I am legally not going to advise a therapist on how to protect their records to make sure that they stay confidential in an electronics health record system. At the same time, we need to be aware that the federal government has pulled people's confidential records from electronic healthcare record systems. I think there are 4 cases that are pretty prominent right now about this. So this is happening. So we have a responsibility to the people of the state of California who are involved in these systems, not understanding that their therapist has signed an agreement that has language hidden in there that says this can actually happen in some specific situations. That is not my responsibility to legally represent them. It is my responsibility to make them aware that this is something that needs to happen. Clinicians need to be aware and clients need to be aware. So that's why these things are really important to me to get into our strategic plan. Once again, not in an effort to give any type of legal advice, This is not a legal question for me. This is a philosophical approach, an action approach for us, the board, to say these things are not okay for our public members in the state of California. That's what the point of all of this is for me personally.
Any other thoughts? Kelly, is your hand up again, or is that left over? Okay. Are there any comments from the public in the audience here? Moderator, are there any comments for those online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, pressing *3. We are displaying instructions and we'll give you a moment.
Sorry, did I put it wrong on there?
All right, this is a moderator. I see no raised hands. I return the floor back to you.
Great, thank you. We already did that one, yeah. Okay, so there's going to be a motion, and I'm going to get myself together and start with the motion going forward, so we don't have to go back around again. But the motion will be to discuss any change to direct staff to discuss any changes, to make any changes, and to proceed to finalization and publication of the board's 2026-2030 strategic plan.
I'm going to modify that motion a little bit, if you're in agreeance. The motion would be to make the changes consistent with the discussion of the board today to approve the strategic plan.
Okay, so to make the changes discussed today consistent with the strategic plan. So that would be the motion.
Okay, Dr. Walker, I'll make the motion as specified by legal.
Is there
a second?
I'll second.
Okay. Comments from the board?
John Sovek, LMFT. So I cannot support that motion because, once again, at the last board meeting, I gave very specific ideas about this, shared them with Steve. I'm going to read those out loud again, what I suggested as a starting point for this, that let me make sure I do this in the right order. Hold on. That the goal was to provide protection and support for marginalized and endangered community accessing mental health services in the state of California. My objectives under it were systems to protect clinical files from unlawful search and seizure, access for therapists to tools for keeping clients safe, control of confidential records in online platforms, EHRs, and guidelines for clinicians working with marginalized communities to help keep their clients safe. And none of those things have shown up in the current draft, not a single one of them. And so I cannot support this motion saying that we're going to let them make changes and approve a finalized draft because none of this language has been included in a previous request. And there have been 3 months in place and ongoing conversations for this to have happened. That's why I cannot support this motion.
I think further discussion is warranted here because we just had, I think, a meeting of the minds and understanding that Steve and staff, the board members and legal were taking in to account your recommendations or your conversations, suggestions that you have with Steve. And I believe I hear Steve saying this morning that there is a willingness in full transparency to include this language, but modify it or adjust it in a way. That's what I hear we're doing, John.
And
are you wanting him to put it
my
in verbatim?
concern about that is in this motion, we're saying make the changes and we're approving the final product. I can't approve that final project in good faith until I actually see the verbiage present in there. Once again, addressing the idea that we had this on the timeline for the last 3 months and really not too much happened on it. So
Okay.
that's why I can't support this motion, which includes saying, and then move it, it's approved as a final.
I hear you, and I'm very sensitive to this, and this discussion and what you're saying. Steve, is this, the approval of this, the strategic plan, time sensitive? Because I'm hearing there's a trust issue here with not believing that it's going to come back in the way that we just discussed.
It's time sensitive just because, I mean, we're looking at trying to establish a new one. I think that let's have that discussion of, do we see, would it be appropriate to have it as an objective?
John?
So I want to be clear, this actually is not a trust issue for me. I do have absolute trust in our staff and our executive officer and our team. It is about actual taking action on an item. Once again, I don't want to call it a trust issue because it's not a personal trust issue. I just need to see the action taken before I can say, this is the final product that I want to put out into the public forum.
John, would that, like for an objective, would that be?
Can you repeat it for me?
Yeah. Well, and that's, I think with I should have brought up your language here. It has to be somewhat achievable for us. And I think we're looking at our mandate is with licensees. So that's where I'm having kind of a disassociation where what can we do for the licensure process or licensees to assist or to do what you're looking for. And that's, I think you can be crafted into an objective where we could then look at those aspects. I think that's where that's where the wording, I think we would need to have it as something we could possibly achieve or even do, I think is where we're looking
So
at.
if we move it from a goal to an objective, places it could go would be in education, places where it could go would be in legislation.
Licensing too.
Okay, it could potentially go into licensing. So there are places it can go into objective status. I need to see crystal clear, concrete language before I can say, yay.
I think we could, I should have had one crafted already. Yes.
What I think from what I'm hearing is, sorry, it fits pretty well under goal 5, I think, because outreach and education, it's basically would be educating both on the consumer side, consumers, here's what information, here's when your therapist has to disclose certain information, be aware of that. And then also for licensees, when you do and do not have to disclose information, even though we can't provide legal advice, we can point them to the law, what the law is, where they can go if they have further questions to get legal advice, like their professional association, or an attorney, things like that. So I think that at least a lot of what John said could fit as an objective under there pretty well. Maybe not all of it 100%, but that's most of what I'm hearing.
And I do see that. So if we could have a 5.3 that addresses my guidelines for clinicians working with these communities, and the objective style would be develop materials to educate clinicians on blah, 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 blah. Perhaps part of it could go under legislative track and blah, 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 legislation that addresses protection of clinical records.
Yeah, we definitely would do that as well. Any sort of bill that was concerning that, yes. And so that could go under legislation as well as monitor and bring to board as appropriate any legislation. Although we kind of already, we would absolutely do that if at any time if that came up, but that could be under legislation as well.
And I think for me, I really want us to be willing to step up as a board and make this as a public statement of who we are. That's why I'm pursuing this so strongly. So we potentially could put some under education, a piece under legislation. Anybody else have any brilliant suggestions, Kelly?
Well, I think it would fit really well under outreach and education. It's pretty clear there. We have we have pursue AI legislation in the strategic plan. I don't think there's anything wrong with saying something like communicating education about the confidentiality of vulnerable populations. I don't see the issue with it. It's and also, I mean, we just did it. Yeah, I'm just looking at the current legislation on this issue. We just did an entire Senate bill on this. So, it seems like it should fit nicely in there. I don't see it as particularly harmful or in any way, and I think it's a very important issue, particularly when the federal government has issued subpoenas to healthcare providers. So, that's my comments.
So would it be possible to maybe draft those two items, or one of two things? We could either draft them right now and approve it, or we could draft it and bring it back in August, depending on the timeliness.
I think we could draft an objective now. Like I said, it would be spread objective to note it within our strategic plan, because the objective will be noted within the goals. And I think, Kelly, you just had a good, not just communicating and educating licensees about the confidentiality and the protection of marginalized communities to that sense. But I almost see that as kind of outreach is where that would fit. But then like I said, with the task goals is really for legislation, is definitely putting a task goal in legislation as part of that would be looking for specifically these types of legislative amendments or whatnot that are going through. But to note it in an objective, in outreach and education, but then making sure that it addresses every aspect of that as a task in licensing and such. So
I'm hearing from staff that we can work on this today. As far as working this through the agenda, can we come back to this?
We could bring it back.
And come back towards the end of the day.
We can bring it back in August too. It doesn't hurt to bring it back in August.
I felt like John had a pretty concise statement written out already that most of could probably go in outreach and education. We might have to tweak it a little, but we could do it. I mean, if we're comfortable with hearing that and doing that again, that would be a suggestion.
I think bring it back in August so we can, if that would be okay with the board.
Yeah, that was going to be my recommendation, is that we bring it back so that we have an opportunity to see what those are.
Okay, so we have a motion on the floor. We can withdraw the motion or we can vote it down, but we do need to proceed on that as well.
So I think we can withdraw the motion with the understanding that we'll bring it back to the August board meeting.
I will withdraw my motion so that we can bring this back for further discussion.
Okay. No, not with a withdraw. We don't need to have a second for a withdraw. That's just a withdraw of the motion. No, we're good.
And we don't have to go back out.
Okay. Okay, so next on the agenda, well, let me ask, do we need to? So we're going to be looking at item 12, Workforce Development Committee update. Steve, would you provide us with an overview, please?
Yes, for brevity, the workforce committee met on April 16th, and we are continuing our discussion on the education changes to the LMFT education. And we looked at practicum requirements, trying to further define those, and some draft language was proposed. If you want additional information, the committee packet is out there on our website. So it's a great progress, and Roseanne's doing some great work on that. And I will open it up for any questions.
Thank you, Steve. Are there any questions, comments from the board? Okay. Any comments from the public in the room? Moderator, any comments from those online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, pressing *3. We are displaying instructions and we'll give you a moment. All right, this is a moderator. I see no request for comment. I return the floor back to you.
Thank you. So we'll go back to Steve again. Never mind, just kidding. So next on the agenda is going to be the board chair report. So please review for upcoming board meetings and past attendance. If you do have any questions or concerns, please let the board staff know. Couple member updates. Want to congratulate Dr. Walker and Kelly and Mr. Huff. They completed their reappointment process. It's exciting. So their appointments were approved by the Senate on April 13th, 2026. It's great. I'd also like to note that Lorez Bailey has been appointed to the Outreach and Education Committee, and Rebecca Thies has been appointed to Policy and Advocacy. Great. So I'd also like to take a few moments to recognize some board staff who've been able to achieve some pretty cool milestones with the state service. So Yi Lee from Board's Discipline and Probation Unit, she achieved 10 years of service. And then Priscilla Sasso from the Board's Criminal Conviction Unit, she also has 10-year anniversary. And then a big congratulations goes out to Raquel Pena from the Board's Criminal Conviction Unit, who has been here for 30 years. So to all of you, we really appreciate your dedication, professionalism, and valuable contributions that you've made to the board in the state of California. So thank you all for that. So next on the agenda is the election of the board chairperson and vice chairperson. So to conduct the elections, we will first be taking nominations for the chairperson position. If you would like to nominate yourself, all nominations will have to be seconded. Once we have a list of nominations, we will then take a roll call vote for each nomination. The nominee with the most votes will assume the position of board chairperson at the next meeting in August. So to kick off the nomination process, I just want to share that Wendy is happy to continue serving as chair. I would love to continue serving as vice chair if all would be in favor of that. So with that, I'd like to nominate Wendy for chairperson. Is there anyone who would like to second that nomination?
Second.
Okay, so Dr. Walker has a second. Are there any other nominations for chairperson? Okay. Would any, so I think we have so we only have Wendy as the person that we have nominating there. Is that correct? Okay. So Rachel, could you help us take a vote for the chairperson?
Yes. So, Dr. Nicholas Boyd,
Yes.
Susan Friedman,
Yes.
John Sovic,
Yes.
Rebecca Thies,
Yes.
Eleanor Uribe,
Yes.
Dr. Annette Walker,
Yes.
Kelly Ranasinghe.
Yes.
Motion carries.
Great. Thank you so much. I'd like to nominate myself for vice chairperson. Would any member like to second that nomination?
Second.
All right. Dr. Walker has a second. Do we have any other following nominations? No. Okay. Raquel, can you help us take a vote?
Kelly Ranasinghe,
Yes.
Dr. Annette Walker,
Yes.
Eleanor Uribe,
Yes.
Rebecca Thies,
Yes.
John Sovic,
Yes.
Susan Friedman,
Yes.
Dr. Nicholas Boyd.
Yes.
Motion carries.
Great. Thank you so much. Really appreciate everybody. So next on the agenda is going to be the budget update. Rachel Lanzone, the board budget analyst, will be presenting today. But we're going to, do you want to do that one, Steve?
Yeah, actually, just in the matter of brevity, I think we're gonna the next updates and stuff. If just to make it a little bit short. I just going to be asking for questions. All the updates are within the material, so I think we could go one by one, or actually, is it okay just to go through items number
7, or well, I don't know the number.
7 through the updates and see if there's any questions on all the updates?
Yeah, and then you can take public comment for all of them at one time.
Okay. So that would be, I don't mind, can I see the agenda over that for a second? So the updates that I was going to present, or were going to be presented, is, sorry there. Agenda items 18 through 23. All the material is in your packet. That includes the budget, administration, licensing, examination, enforcement, and outreach and education report. If you have any questions, I'll let you open up for questions.
Okay. Are there any questions from the board members? Dr. Walker?
Thank you. I have a comment on agenda item 23, the outreach and education report. I want to applaud Steve for problem solving. We're looking at how do we combine, integrate, or condense the former outreach and education update with the outreach and education committee meeting update. And I don't know if you realize you did this, I hope you do, but you made your update a report. So now it's inclusive of the outreach and committees, meeting minutes and outcomes and things like that. So I applaud you for getting that done. Let's see, I'm looking at my notes here. Yeah, so great work on that. Thank you.
My question pertains to item 18, the budget update. Does the state fiscal picture with a projected deficit impact this board in terms of the governor preparing to borrow special funds from boards and other agencies?
It does, and last year they accepted $10 million from us.
Mm-hmm.
So I don't think there will be any more distributions from us, and I forget when that's going to be paid back. Usually at about I think it's like a 2-year span, or
I believe it's estimated for fiscal year 28-29 for
Okay.
repayment, but that might be flexible.
okay, yeah, and if not, then it's usually if we have a situation where we need it back, they will look at that and at repayment for that. So just a note on that too. I guess we do have stuff in there. July 1st, we do have the fee change reduction going into place. So another note.
Any other comments or questions from the board? Any comments or questions from the audience? Moderator, any comments from those remotely online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've dialed in, press *3. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment. I return the floor back to you.
Great, thank you so much. So next on the agenda is going to be the Department of Consumer Affairs update. Lucia Saldivar, Deputy Director of DCA's Board of Bureau Relations, will be presenting an update on the Department of Consumer Affairs.
Is she here?
I think she's here.
Let's skip that.
Yeah, let's skip it.
So I guess we'll skip item 24, perhaps come back at some point today. So we'll move on instead to item 25, update of the Association of Marital Family Therapy Board's Marital and Family Therapy National Examination Transition Efforts. Steve, can you please provide us with an update?
Yes, we continue on to provide the updates to the MFTRB exam, and the big item on there right now is to kind of discuss the rulemaking process is really where we're at right now. One of the main focuses of the possible transition to that. So if you remember, following in in 2025, no, it's actually August 2025, the board approved regulatory amendments that would designate the AMFTRB exam as the clinical exam for LMFT licensure. Since then, several things have happened. In the development, we've noticed, not in the development of the regulations, some things were brought to the attention, our attention, and other things have gone into play, such as regulatory amendments to the sections related to the examinations amendments have been adopted. So we have to further later on go clarify and reapprove our amendments. Additionally, I think I might explain this last time, during the regulation process, we looked and we thought it was beneficial for us to do what is called a new linkage study. And so that is where we are at right now. So in 2022, when we originally were looking at the AMFTRB exam, OPS performed a linkage study for us. And really, the linkage study is to evaluate the extent to which content reflects the description of practice in California, and also to determine not part of the linkage study, but they also had an overall study which determined if the exam was psychometrically sound and appropriate for use in California. And so since then, AMFTRB has updated its examination content on findings from a 2025 occupational analysis that included input from California licensees. And since the end, like I said, we asked them to do a linkage study in 2025. I kind of put some language in there. We have to follow. When we're looking at exams, we look at the California Business and Profession Codes 139, and it reflects the legislature's intent that license examinations be grounded in occupational analysis and are periodically validated through psychometric evaluation, and that the evaluation should be updated consistently. So we are currently working with OPS, AMFTRB, and myself. We're working on to complete the linkage study that we would bring back in August for the board to look at. And at that point, we will also bring back the regulations with the amendments and look for a possible final approval of the regulatory language that would make AMFTRB the clinical exam for California LMFTs. Just to note, with this process, we already talked about it I think at the last board meeting. Definitely, we were looking at January 1st, 2027 as a possible implementation date. With the work that needs to be done, we were talking about a possible July 1st, 2027 implementation date. That said, we're not sure. So we're going to keep looking at that July 1st, 2027 date, but for the regulation process, it takes a long time. So that's one of the main time constraints we have with that July 1st date. Additionally, I included in there information. We'll talk more and more as we get closer, or once we get to if we do approve, we'll definitely provide more and more details on the administration portion of the exam. But I wanted to start the board understanding kind of how the examination administration works for AMFTRB and the possible differences. There's definitely a fee difference in the cost, $370. We've talked about the scheduling, that we currently have all constant scheduling. You can schedule the exam whenever you want. AMFTRB does 1 week a month, but they've also expressed in public, I believe to us too, that they're looking at expanding their accessibility to those exams, more weeks, possibly more times. So we're working on that. There's some differences in the retake policies. The format definitely is a little bit different in the amount of questions. The hours are the same. The California, we have 150 questions. AMFTRB has 180 questions, and that's for a 4-hour exam. And just some differences there wanted to lay out. I think more importantly, what I want to express in this is we're looking at the linkage study right now. So OPS is seeing where if you look at both of the exam content formats, do they link up? And so they will provide us with a full detailed report in August when we look at the regulations again. So.
Thank you, Steve. I did have a question. Oh, sorry. Yeah, go ahead, Susan.
I have a quick question. Steve, you mentioned that there was some questions from licensees, and I'm wondering how many licensees you heard from and what kind of questions? Or how did you hear from them?
Well, I think we're not really, I mean, the questions that we're hearing from, I just got back from the camp conference, and the most questions were demystifying that we're not going forward with this on January 1st. Kind of wondering what, when are we going to go to the national exam? Additionally, I think they're looking at the portability is what the big question is. It's like, if I take the national exam, does that mean, if I take the national exam, does that mean I can be licensed anywhere? And so that's the kind of questions we have. CAMPT has done a really good job. They went out and actually collected questions from their licensees, and they actually on their website now have a great FAQ resource for all those various questions. So the board itself, I mean, I don't believe from licensing we're getting too many questions at the board level, but CAMPT I think is. So
it definitely was to the different organizations.
I'm sorry?
Definitely the questions went to the different
Oh yeah,
organizations.
questions they're getting from their members.
Steve, I did have a question about the the scoring report. So it looks like for California, the report's available at the immediate completion of the exam, but AMFTRB, there's a 20-day business day delay before testees will find out. Is that right?
I have to clarify if I don't believe they get the actual the score report. I don't know if they get any indication at the end of the exam. The reason why there's not a delay but a 20-day waiting period is we test on a continual basis because we have 4 different exams going. We have a cycle of 4 different exams, so that allows us to do automatic testing and score reporting. What AMFTRB, the process, and I know Lois is online, you can correct me, but they give the exam for that month, and then they evaluate the exam to make sure that it is, it all went well, meaning looking at it psychometrically, and then they will give the scores. So
I guess my question is, does the testee get do they find out at the completion of the exam if they passed or failed the exam, or do they have to wait 20 days to learn that information?
I will have to get that clarified, and maybe Lois, if you're still online, you can say, I think they have to wait.
Okay. So I think that would be a concern for me, if that's true. But yeah, if we can get some more information about that, that would be helpful. Are there other comments or questions from the committee? Okay. Any comments from our in-house audience?
Good morning again. My name is Shanti Ezrin with CAMPT. Wanted to just start by thanking you for the update today and for the transparency in the rulemaking process. Really appreciate the board for your thoughtful approach and seriousness in evaluating the national exam content through a new linkage study. So we're very much looking forward to seeing the results of the linkage study and also the updated regulatory language at the next August board meeting. While I'm up here, I also want to take the opportunity to acknowledge just the ongoing discussion surrounding the transition to the exam, some of which was mentioned already. As with any transition, questions and adjustments are definitely to be expected. CAMPT, we take all feedback very seriously, and we remain very committed to working collaboratively with all stakeholders, including, BBS staff and AMFT RB, to ensure that the final outcome reflects the highest standards for MFT licensure, while continuing to prioritize public protection. So all that said, and at the very same time, we remain strongly in support of moving forward with the transition to the national exam. Again, the national exam is already used, and it's used successfully in 49 other states, and we believe it offers an important and valuable opportunity to align California with national standards, among many other reasons. We have submitted several letters already to the board and staff that outline our support in greater detail, and just again appreciate your ongoing engagement in this process.
Thank you. Any other comments from those in the audience? Moderator, any comments for those online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name or pressing *3 if you've called in. And I do see raised hands. We'll start with Rochelle Cipollone. Rochelle, you should see a prompt to unmute.
Good morning, everyone. My name is Rachel Cipollone. As mentioned, I'm attending on behalf of Ben Caldwell, and he asked me to share the following. In January of 2026, a new exam plan for the national MFT exam was implemented. The exam plan outlines what knowledge may be covered on an exam, and examinees rely on it to guide their preparation. The 2026 exam plan wasn't published at all anywhere until late February. This means that January and February examinees were tested based on a secret plan they couldn't possibly have prepared for. And it wasn't until late April that AMFT-RB fully removed the conflicting old exam plan from its website. So March and April examinees were presented with two different plans, each of which was presented as official and correct. They too had no way of knowing how they should actually prepare. In contrast, ASWB and MBCC are both planning changes to their national exams. Those organizations have provided clear guidance to examinees months in advance of planned changes, as required by testing industry standards. After receiving significant external pressure, AMFT-RB is now offering refunds of re-examination fees to those who attempted from January through March. That's a step in the right direction. But considering that this didn't happen until the issue was called out publicly, months after they say they were aware of it, we have serious concerns about AMFT-RB's commitments to testing industry standards, accurate and timely communication to examinees, and a generally fair and equitable exam process. While we continue to support the transition to the national exam in concept, we ask that the draft regulations to be brought forward in August provide the opportunity to pump the brakes if that time AMFT-RB has not fully implemented
15 seconds.
Structural changes to ensure that mistakes like those it made at the beginning of this year never happen again. Thank you.
And next we have a comment from Lois.
Am I unmuted?
Yes, we can hear you.
Okay, thank you. Yes, in January, in a meeting with your board, we discovered that a content outline had been reprinted from the 2025 candidate handbook into the 2026 candidate handbook. The handbook was corrected the second week of February. Candidate handbook is the main communication with changes of this nature. We also would like you to know that candidates who apply for the exam for months ahead of time have access from November and December to both handbooks, so they have the ability to read both. We did make a misprint error, for which we have done the best that we can to offer a way for candidates who failed January through March, the option to retake the exam. At this point, several have already retaken the exam and had been using the correct handbook. Once that appeared at the beginning of February, that was the only handbook available with the correct information.
All right. And our next comment is from Roger Smith. Roger, go ahead and click on the prompt to unmute.
Thank you very much. I'm Roger Smith, Chief Advocacy Officer with the American Association for Marriage and Family Therapy. Thank you happy to be here at the meeting and give these very brief comments. AMFT joins with CAMP in strongly supporting the board's plan to move forward with adopting AMFT RB National Exam as a clinical exam for licensure as a marriage and family therapist in California. By implementing these important changes, California will join the other states in the District of Columbia in recognizing the AMFTRB National Exam as a clinical exam for licensure for MFTs. Adopting the exam will also align California with the exam requirements found in the remaining states and improve the ability of MFTs in California to provide service virtually into their state. Since the national exam was first offered in 1989, thousands of MFTs have passed this exam, representing almost all MFTs licensed outside of California. The other states have continued to support the national exam by maintaining this exam as a clinical exam for MFT licensure. We believe the adoption of the MFT-RB national exam will greatly facilitate the ability of California MFTs to obtain additional MFT licenses and to promote the profession as well as protect the public in California. Thank you very much for consideration of these comments. I really appreciate it.
All right. And our next comment is from Kathy Atkins. Kathy, you should see a prompt to unmute.
Hello again, Kathy Atkins from CAMP. Thank you to the BBS for the overview, and to underscore Shanti's testimony. We appreciate all stakeholders' ongoing assessment and scrutiny of this transition, including the test itself, as well as the accompanying processes. We continue to consult with multiple stakeholders, including AAMFT, AMFTRB, BBS, Dr. Caldwell, and many others. And we really do take seriously any and all issues that arise as to the areas of improvement in the test itself and or processes that need to be evaluated and possibly adjusted. CAMP, we absolutely continue to support the transition to the AMFTRB exam. And we are dedicated to the continued advocacy for high exam standards and processes, recognizing that California MFTs demand transparency and clear communications. And that is largely our job, and we will continue to advocate and demonstrate such with our partners and the stakeholders. We look forward to working with all stakeholders to ensure a quality exam and fair test procedures for the sake of both our licensees and all of the California patients and consumers. Thank you so much.
All right, this is the moderator. I see no further requests for comment. I return the floor back to you.
Great, thank you so much. Before we move to the next item, I'm wondering if it would be good for us to take a break. Okay.
I would appreciate one.
Yeah, I think so. So if we have to do 15 minutes, correct? So we'll take 15 minutes, which will put us back at what time? 10:14? Okay, we'll see you at 14. So it is 10:19. I believe we will need to reestablish quorum. Is that correct?
Yes.
Yeah, so I think we have to.
Actually, no, we don't need to do
We
that.
don't need to?
No,
Okay.
no.
All right, very good. All right, so we're gonna pick up here on item 26. And what I would do is I'm gonna ask Christy. No, 26. Item 20.
Yes.
Yeah, we finished the. Yeah, we finished. Yeah.
We skipped that one.
We apologize. In full transparency, the other board members are asking what agenda item we're on. So just to clarify.
So we were going to jump to 26, but I know Shelley's here as well, but I think we're going to continue with 26. So that's okay.
Sure, that works for me.
Okay, so what we'll do is have Christy, if you can help us with the first motion, and then we'll open it up for discussion with the board.
Absolutely. Everything's very wordy, as you know, so I'll get through this as quick as I can. So this is discussion and consideration of comments received on the modified text regarding our rulemaking about continuing education, exams, and renewal regulations, and then potential adoption of amendments to those sections. So these regulations were originally approved in February 2025. They were noticed to the public in December 2025. We initially received 6 public comments that the board considered in February 26th, and at which time changes were recommended. So those were noticed to the public in March. During that 15-day modified text comment period, we received 4 comments, which are in the attachments. We also have the board-approved language that was noticed for that comment period as an attachment B. So board staff and regulations council, we have Christy Shield here to assist. We recommend that the board approve the following proposed responses to the comments. The first comment is from Shanti Ezrin from CAMPT. They indicated that they appreciate the modifications to the text, but they also provided an adverse comment regarding the added language clarifying that CE hours earned via supervision shall not be used to satisfy the supervision, training, or coursework requirements for supervisors. As drafted, the modified text does not address whether CE credit earned through supervision may overlap with the existing 6-hour law and ethics course requirement. We respectfully request clarification as to whether the board intends to allow the 6 hours of CE credit earned through supervision to count toward the law and ethics course requirement. For example, if a supervisor provides supervision that addresses the pre-licensee's legal obligations, could those hours count towards satisfying the law and ethics CE requirement? If this is not the board's intent, we recommend that language be further clarified to explicitly state that hours earned via supervision may not be used to satisfy the law and ethics requirement. We're concerned that without this clarification, individuals could interpret the regulation that would be allowed. So we do, the recommended response is that the board acknowledges the favorable feedback and accepts the adverse comment regarding that clarification. Law and ethics requirements exist to ensure every licensee receives consistent, structured, and current instruction on legal obligations. With supervision, it varies by supervisor, setting, and cases, and therefore would not be suitable to count towards this requirement. While the provision of supervision involves deliberate and systematic planning to design, organize, and facilitate learning experiences that support a supervisee's professional growth, skill development, and competency attainment, including in law and ethics, requiring all licensees to take 6 hours of actual coursework in law and ethics helps to ensure they have an understanding of new legal requirements and ethical considerations and how to apply them. So we are proposing the highlighted amendment just to clarify that the law and ethics portion of the continuing education requirement for licensees specified in subsection E does not apply toward those, the law and ethics course. The next comment is from Anna Pallid. She stated that when her comment was, when people give birth, they should qualify for a waiver of continuing education. And so she suggested where it should be added in the form, where she suggested adding that if you have a new baby, that you should be able to be considered for a continuing education waiver. We recommend that the board reject the comment and decline to make any changes, as this comment did not pertain to the modified text. However, the board would like to clarify that existing language authorizes a licensee to qualify for a waiver if they have a physical or mental disability that limits one or more major life activities, or the licensee is the primary caregiver for a new baby who has a total physical or mental disability as noted above and in regulation.
The board acknowledges receipt of the concerns of the commenters' difficulty determining how to comment on the board's pending regulations, but declines to make any further changes. The board's notice of proposed regulatory action was posted, mailed, and emailed to individuals required to receive notice in compliance with government code, and provides instructions on how to submit a public comment. The next comment is from Rachel Michelson. Rachel provided the comment stating, well, initially asking, what is the purpose of continuing and for licensed personnel? I think she meant continuing education. In my mind, it's to keep people up to date and learning new skills to provide high quality service. What you've proposed does not actually help with that. I don't think you're going to get more supervisors by offering reduced CEs. I'm concerned about the quality of supervision you're going to get, as supervisors will be getting less CE. I can suggest you consider another way of incentivizing licensed professionals to supervise. For example, paying a certain amount of money towards CE courses. We're finding other funds to pay them to provide supervision. I imagine you'll say there isn't money for this, but I encourage you to think outside the box. I suggest you find another way of incentivizing licensees to attend your meetings or provide you with feedback, as again, I don't think attending meetings meets the goal of CE. Want to encourage you to think about the purpose of CE versus the other goals you're trying to reach. They're not in alignment, and it's disturbing to me that you would encourage people to get less training to meet other needs of the profession. I teach a lot of CE classes, particularly in the Title IV E realm, and I know people need more CE and high quality education. I know this from the types of questions I'm getting and the not always excellent responses to vignettes and other questions I provide. We're recommending that the board reject these comments, which appear to generally recommend not granting CE credit for supervision or meeting attendance based on the commenters' belief that credit would not keep people up to date and learning new skills, that quality of supervision would be adversely affected, some supervisors would be getting less CE, or that the proposal would encourage people to get less training to meet other needs of the profession, and in their experience, people need more CE and high quality continuing ed. We recommend that the board decline to make any changes due to these comments. At the meeting in February 2026, the board responded to several similar comments expressing concern about the number of allowable hours for non-CE course activities, including provision of supervision and meeting attendance, and discussed the potential negative impact on a licensee's ability to learn about updates in the profession if maintained at the originally proposed 18-hour allowable credit for supervision and the proposed 6-hour credit for board and committee meeting attendance. At that meeting, the board recognized the learning opportunities provided via supervision and meeting attendance and decided to keep those provisions, but eliminated credit for committee meeting attendance and reduced the number of CE hours for supervision down to 6 due to concerns expressed by commenters. Upon review, the board still believes, based on its experience, that the deliberate and systematic planning a supervisor undertakes to design, organize, and facilitate learning experiences to support a supervisee's professional growth, skill development, and competency attainment should be recognized as CE and credited as such. Similarly, board meeting attendance supports a licensee's learning about current issues in the profession, new research, and perspectives beyond their current expertise, and should be recognized as an educational opportunity. With these proposed modifications from February 2026, the board has balanced the regulated community's concerns about professionals staying current, using traditional learning methods with its goal of recognizing diverse learning opportunities by limiting these activities to 6 hours of CE credit. The commenter also recommended that the board consider another way of incentivizing licensed professionals to supervise. For example, paying a certain amount of money towards CE courses or finding other funds to pay licensees to provide supervision. The board is not authorized by law to incentivize licensees to provide supervision as recommended by the commenter. As a result, the board rejects this comment and declines to make any changes in response to that comment. Kaelisa Rowan provided a comment on the proposed CE disability waiver form, stating that when someone needs a waiver due to caring for a family member, it's possible the family member is incapacitated and cannot themselves sign to waive their medical privacy. I did not see any reference to this situation in the proposed regulation or on the proposed form. There should be clear instructions on how an authorized representative can sign the form on behalf of the family member when the family member is incapacitated. The recommended response is to acknowledge the favorable feedback on the text, but to checked the adverse comment regarding amending the waiver form and declined to make any changes due to the comment. The comment did not pertain to the modified text. However, the board would like to clarify that in such a situation, the licensee would be directed to consult with the incapacitated family member's healthcare provider regarding who could sign on their behalf to authorize the requested information. For example, an agent holding a durable power of attorney. So as you've seen, there is a part A and a part B to this agenda item. And so the part A is where you would consider the comments and determine whether you would approve the recommended response. So you have two options. Option 1 is if you agree with the recommended responses, and option 2 is if you have any edits or you disagree. So anyway, you have I'll turn it over now for the next step.
So we have one of two choices in terms of what motion we want to make here. I guess at this time we can have comments from the board, if there are any. Well, we don't. Well, we're not taking a motion because we have to figure out which motion we want to take.
Yeah.
I have a comment. If you're
Go ahead, Kelly.
So I have no problem with the proposed comments, but is there a regulatory requirement to respond individually to each commenter? I'm just wondering why we are doing that.
Okay, this is Christy Shields, Regulations Counsel for the board. We are required as part of the requirements for the Administrative Procedure Act to respond to each comment and indicate whether it is accepted or rejected and whether any changes to the text were made in response to the comment. It's part of the requirements for submission of the final statement of reasons, which is included in the rulemaking file. And the reason we bring it to the board is because the board is the policymaker and the decision maker authorized to accept or reject comments and make changes to text. So we have to bring it to the board meeting and ask whether you want to accept or reject the comment or make any further changes. So that's the way it's drafted.
Got it. So it's under the Administrative Procedures Act. It's a requirement for
Correct.
regulation to move forward. Okay, thank you.
Yes. You're welcome.
So I'll propose that we make a motion for option 1 to accept, and then if there's if that's not favorable, then we can come back and look at a separate motion. Okay.
So clarify your motion. So are you suggesting option number 1 to direct staff to proceed as recommended as specified and provide the responses to the comments as indicated in the staff recommended responses?
That's exactly it.
Excellent.
I'll second.
Okay, Raquel, can you help us with the vote, please? Oh, sorry. I'm sorry, comments. Are there any comments from the board? No? Any comments from the public?
Hi, Shanti Ezrin with CAMT. Just wanted to thank Christy for your work on this entire rulemaking package, and thank you also for considering all the comments that we provided through this process and for taking the appropriate amendment that we saw here in the modified text. Thank you.
Seeing no other comments in the audience, moderator, do we have any comments online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, pressing *3. We are displaying instructions and we'll give you a moment. This is the moderator. I see no requests for comment. I return the floor back to you.
I had a comment.
Okay, go
This is
ahead.
Eleanor Uribe. So I mean, I think there's some of these things are just maybe some of them are a misunderstanding. And so we're able to, I guess, clarify how it might fit in. But I don't know if there's, maybe if we keep getting certain comments, maybe we can have commonly asked questions somewhere along the line. So at least they know how it might apply. So, I mean, there's some valid concerns here. But like it was said, it was addressed somewhere else, or it could be applicable. So.
Okay, thank you. Okay, so at this time, if there's no further board comments, Raquel, can you help us, please, with the vote?
Kelly Ranasinghe,
Yes.
Dr. Annette Walker,
Yes.
Eleanor Uribe,
Yes.
John Stovic,
Yes.
Rebecca Thies,
Yes.
Dr. Nicholas Boyd,
Yes.
Susan Friedman.
Yes.
Motion carries.
Great. We'll come back to Christy to see if you can help us with the Part B.
Thank you. Okay, so Part B, we have two possible motions. So the first one is to be used if the board has no suggested changes for the proposed modified regulatory text. So the change that we are proposing making, if you're okay with that, we would do motion A. If you want to make a change to that language, then it would be motion B. And of course, I will be happy to read that for you.
Yes, please, if you don't mind.
And with that, I'll make a motion on Part B with your help to accept motion A.
Okay, sure. I'll go ahead and read that. Approve the proposed second modified regulation text as set forth in Attachment A and direct staff to take all steps necessary to complete the rulemaking process, including preparing second modified text for a notice of a 15-day public comment period. If after that 15-day comment period, the board does not receive any objections or adverse recommendations specifically directed at the modified text, the notice, or to the procedures followed by the board in proposing or adopting this action, authorize the executive officer to make any non-substantive changes to the proposed regulations and rulemaking file, and adopt amendments to Title 16, CCR, Sections 1822.51, 1829.2, 1877.2, 1887, 1887.1, 1887.2, 1887.3, 1887.4.2, 1887.4.3, and 1887.12 as set forth in Attachment A.
Second.
Okay, are there any other comments from the board? Seeing none, any comments from the public? Seeing none, are there any comments, moderator, from those online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, pressing *3. We are displaying instructions and will give you a moment. This is the moderator. I see no request for comment. I return the floor back to you.
Great, thank you. So we're looking at item number 27, and we will be looking to have a discussion. Oh, I'm so sorry. Just kidding. We're going to have to take a vote. Got ahead of myself. Yes, please recall. Thank you. Thank you for the reminder.
Okay, no worries. Okay, John Stovic,
Yes.
Rebecca Thies,
Yes.
Dr. Annette Walker,
Yes.
Kelly Ranasinghe,
Yes.
Eleanor Uribe,
Yes.
Susan Friedman,
Yes.
Dr. Nicholas Boyd.
Yes.
Motion carries.
Thank you. That was important. Okay, so item number 27 now. We'll have a discussion and possible action to approve amendments to Assembly Bill 1598, and we'll turn it over to Roseanne at this point.
Thanks, Nick. So the board is sponsoring AB 1598 this year, and this proposal represents the first step in restructuring and modernizing the board's licensing process. So we're making several significant amendments to the licensing process in this bill to try to help with some of the bottlenecks where we currently see problems with gaining experience hours. So we're increasing the amount of time supervised experience hours remain valid from 6 to 7 years. We're proposing to increase the maximum number of registration renewals for associates so that there is a total of 7 years of registration before a new number is required instead of 6. We're allowing associates with a subsequent registration to request a one-time 2-year hardship extension to work in one private practice setting with their subsequent number. And also, as part of this bill, we are modernizing the exemption language for faith-based counseling by clarifying the criteria for when faith-based counseling is exempt from licensure. And so we had some amendments that were requested regarding that center around the wording of the exemption language for faith-based counseling. And the amendments were needed to Business and Professions Code 4980.01 for LMFTs, 4996.13 for LCSWs, and 4999.22 for LPCCs, based on stakeholder concerns raised by representatives of the medical and psychology professions. They pointed out some unintended consequences created by the exact wording of the language we were proposing. The statutory changes that were being proposed, when they outlined practice exemptions for other license types, and pastoral counseling was kind of tied up in those practice exemptions. So when we drafted the language, the pastoral counseling exemptions needed to sort of be untangled or separated out from the other practice exemptions to fully clarify them. So that was the goal of the amendment. And then while we were doing that, we noticed that each section has sort of historically been structured somewhat differently. So we attempted, when we were doing this untangling of the pastoral counseling, we tried to use the amendment opportunity to improve clarity and create more consistent wording across the board's licensure acts regarding the exemptions. And we used the LCSW statute as a model in that case because it was sort of the most cleanly structured. And in that particular section happened to use some language restricting the use of the term psychosocial. So when we sort of consulted with our SMEs and just had a discussion, there was kind of a discussion that psychosocial should include psychotherapy. So we added that in and applied it to all three, applied the LCSW language to all 3 license types. However, the Medical Board and Board of Psychology correctly noted that physicians and psychologists are authorized under their scopes of practice to perform psychotherapy and related activities. And as a result, the terms psychosocial and psychotherapy needed to be removed from the prohibitions in order to avoid unintentionally having language that restricts physicians and psychologists from practicing psychotherapy. And so what we decided to do was, rather than try to restructure the exemptions entirely, we made amendments to basically go back to the exemptions for to have each practice act keep its current exemptions as they've evolved over time, but just sort of untangle only the pastoral counseling piece and not try to negotiate major changes to the structure of the exemptions for the other professions. It was not causing any problems in those practice acts. Everything was fully covered, just in different ways. So we have reverted the LMFT and the LPCC exemption language to ensure that pastoral counseling is carved out, but that the other original language is preserved. And then we just made the needed amendments in the LCSW law to take out psychotherapy and psychosocial as well. It's still, the amendments still preserve the intent because you have to be basically practicing in your scope of practice according to the language in order to be in order to have an exemption. So the amendments were made on April 15th as part of the bill going through its first policy committee, Assembly, Business and Professions, but we do need the board to, because it's a board-sponsored bill, we need the board to approve the amendments. And so that is what we are opening it up for discussion today.
Do we have any comments from the board?
Dr. Walker, Public Board Member. I just want to thank the Policy and Advocacy Committee for the hard work that they've done on this and then bringing this forth to the board in a timely manner. I would entertain a motion at this time. Do you need a motion or is this just discussion?
Yeah, we need a motion. The motion would be to approve the amendments to AB 1598 as shown in the attachment.
Okay, I will make a motion as stated by Roseanne.
Do we have a second?
I'll second.
Okay. So coming back around, any further comments or questions from the board at this time? Seeing none, any comments from the audience in the room?
Hello again, Shanti Ezrin with CAMP. Roseanne, just wanted to really quickly thank you for your work on this and just being responsive to the stakeholders that have reached out. And CAMP, we're going to be looking at the recent amendments to the bill and assessing a position from there. Thank you.
Bindu Makamla, Policy Manager with the NASW California. We support the board-sponsored bill AB 1598. The updates within this bill will support the retention and advancement of associate and licensed clinical social workers while maintaining important consumer protections and bolstering the state's behavioral health workforce capacity. Therefore, we appreciate the board's leadership in advancing thoughtful, practical reforms that strengthen the profession and improve access to behavioral health services across the state. Thank you.
Good morning, Chair and members of the board. My name is Carl Miller. I am an LCSW social worker in CDCR. I work at CHCF in Stockton in the psychiatric inpatient unit. I am also the president of AFSCME Local 2620. I'm here today in support of the amended version of AB 1598. We appreciate the board's work and the amendments that have clarified and narrowed earlier concerns, particularly around the professional scope and the protection of licensed practice. The bill now takes a more balanced approach by modernizing licensing timelines, improving consistency across behavioral health professions, and creating additional flexibility for associates that work towards licensure while maintaining professional standards and public accountability. In high-need systems like corrections, where I work, and public behavioral health, workforce stability matters. These changes help support that pipeline of qualified clinicians while preserving the integrity of licensing professions and the quality of care provided to vulnerable populations like the ones that we work with. We also want to express our support for SB 993, which you'll be talking about later, which addresses important worker safety concerns for mental health professionals in correctional settings and psychiatric settings. Protecting clinicians from unnecessary disclosures of personal identifying information is a common sense safety measure that helps support recruitment, retention, and the long-term stability of the behavioral health workforce. So we just want to thank you for your time and consideration. So appreciate it.
Thank you very much. Seeing no other comments here in the room, moderator, do we have any comments online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, press *3. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment. I return the floor back to you.
Great, thank you so much. I think we are ready for a vote.
Just to clarify, the motion was to approve amendments to AB 1598 as shown in the attachments. Motion by Dr. Annette Walker and seconded by Susan Friedman. Okay, perfect. Thank you. Okay. It's Dr. Annette Walker.
Yes.
Eleanor Uribe.
Yes.
John Sovic.
Yes.
Rebecca Thies.
Yes.
Dr. Nicholas Boyd.
Yes.
Susan Friedman.
Yes.
Kelly Ranasinghe.
Yes.
Motion carries.
Thank you, Roseanne. We're going to come back to you. So we have discussion and possible action regarding the Policy and Advocacy Committee recommendations for all of the bills, but I'll let you go through them one by one.
Okay. Yes. Thank you, Nick. So yeah, I want to just start out. We have a lot of timely bills today that I think address a lot of the issues that come up in a lot of our board meetings. So
Roseanne, I'm so sorry, just really quick. I just want to make an announcement that one of our board members is going to be stepping away, but we do still have quorum. Just sorry to interrupt.
Oh, it's okay.
Thank you.
So, so I want to kind of go over a little bit of information, just for review. There's several different positions that the board can take on bills, or the board can choose not to take a position on a bill. Sometimes we are bringing a bill to the board because we want the board to be aware of it. But the board may choose that they don't want to weigh in, and that's totally acceptable too. But aside from the obvious positions which are support or oppose, there's also a support if amended. That's kind of a position if there's amendments that the board would like to see in order to support the bill, and if they're not made, then the board would have a neutral or no position on the bill. And then there's also the oppose unless amended position, and that's a little bit different. That's has a little bit more teeth in it to sort of try to gently encourage amendments a little bit harder. Whereas if the author does not amend the bill, then the board would move to opposition. And the board would, if the bill was amended to the board's liking, then the position would be no position. So that one's a little bit stronger. Also, there's the no position stance, which just means that instead of, writing position letters to the appropriate legislative committees and the author and attending hearings to state the board's position, we would just not do any of those things. So that's what a no position means. There's a lot of bills there's been a lot of amendment activity lately. And so to avoid losing a position sort of right after our board meetings, a lot of the AI bills, they're sort of negotiating with a large number of people and trying to sync them up so that they are all consistent. They're all compatible with each other. We did ask legal to modify our motion. So we have an option to motion to delegate authority so take a position, but then delegate authority to the board chair with the assistance of the executive officer to modify the board's position in response to any subsequent amendments to the bill. So that would be if there were some amendments to the bill that are that the board chair feels comfortable with, then we would keep our support. If we were supporting, we would keep our support position, things like that. The board will get a chance at its meeting in August to, if there's any of these bills are still moving, there will be another chance to take positions on updated versions of them. But at that point, it's pretty late in the legislative process. So they'll pretty much be almost going to the governor by then. So there won't be a lot of, the legislature won't be as receptive at that point, or even maybe have the ability to make a lot of amendments at that point. So that's why, kind of one of the reasons why we wanted to do that now. So I'm going to be reading that into the motions, unless there's one for some reason you don't want to, and you can say that. So with that, I'll get started with AB 1558. The Policy and Advocacy Committee did not recommend a position on this bill. But this is the Uniform Emergency Volunteer Health Practitioners Act. And so this bill would enact a Uniform Emergency Volunteer Health Practitioners Act to standardize how volunteer health practitioners are registered, verified, and then deployed during declared emergencies in California. It defines what constitutes a registration system, defines scope of practice rules, and provides the Emergency Medical Services Authority, EMSA, which is a state agency, the authority to regulate volunteer deployment and coordination during emergencies. So right now, there's a couple of different already existing systems in place. There's the Emergency Management Assistance Compact in federal law for providing mutual assistance between states and managing emergencies. And then the state has EMSA, which develops planning and implementation guidelines for emergency medical services systems. And so that was the system in the state agency during the COVID-19 state of emergency that facilitated allowing some out-of-state practitioners to assist with the efforts in California. This bill is trying to create a little bit more comprehensive system for future emergencies. It sets requirements for a state compliant volunteer health practitioner registration system. It allows EMSA to regulate volunteer health practitioners during an emergency for things such as the types of practitioners permitted and the duration of practice. It allows a volunteer health practitioner who is registered with a state compliant registration system and licensed in good standing in their state to practice in this state while an emergency declaration is in effect in compliance with this act. And it permits the licensing board of those professionals to restrict or modify the health services that they may provide. It prohibits volunteer practitioners from being found to have engaged in unauthorized practice unless they had a reason to know of a limitation or modification that a similarly licensed practitioner should have known. And it provides a licensing board with the power and duties to impose sanctions on a health practitioner licensed in this state or out of state for violations. The author is trying to basically address some of the delays that they've had during past emergencies with deploying volunteer health practitioners. They state that volunteers often cannot be deployed until the state formally approves them to serve, and the approval process takes time and can delay response efforts. They also note that 22 other states, including Illinois, Washington, and Texas, have passed legislation similar to this. In terms of some of the concerns or some things to point out regarding this bill, at the Policy and Advocacy Committee, we discussed a couple of concerns, and staff reached out to the author's office to provide technical support. So a couple of those things that we've reached out about is the section 8599.57A states that a volunteer health practitioner practicing here must adhere to the scope of practice for a similarly licensed practitioner in the state. And there is a concern that similar is somewhat vague. LMFTs and LPCC licensees could be considered similar professions. Staff recommended that the term similarly be replaced with equivalently. It sounds like the author is likely open to that change. There was some concerns about the unauthorized practice clause in 8599.57E. The subdivision prohibits a volunteer from being found to have engaged in unauthorized practice unless they had reason to know a limitation, modification, or restriction would not, that a similarly licensed person would not be permitted to provide. So they would have to have had reason to know it. That might be concerning from a consumer protection standpoint, as a practitioner could simply claim ignorance and avoid accountability. So we recommend, we noted in a message to the author that the bill could be amended to require all volunteer health practitioners to attest that they have reviewed and will comply with the California scope of practice. Additionally, the Policy and Advocacy Committee noted that psychotherapy services differ from other types of health services provided under this bill because they are typically ongoing services. And therefore, we suggested in our outreach that it may be appropriate to require mental health professionals practicing under the bill's allowances to provide a notice to clients of the short-term limited nature of the health services provided, and attest that they are aware of the applicable scope of California practice. So we reached out to the author's office. We have not heard back on those things, but it's still kind of early. Bills are in their first fiscal committee, and once the fiscal committees sort of end in mid-May, there'll be like more rounds of amendments will be going on. So that's when they usually consider that kind of feedback, is when they switch houses at this point. So that's a sort of the feedback that we reached out with based on the discussion at the Policy and Advocacy Committee meeting. So now at this point, we can open it up for discussion and determine if the board would like to take a formal position.
I do have a question. So how would the state know who's practicing under this authority, under this bill?
It provides registration systems, basically, and sets the criteria for that. And then EMSA, which is the state agency that sort of has jurisdiction over emergency healthcare services, would basically, the registration systems would confirm to EMSA that those practitioners are available to practice.
Okay. Are there any other comments?
Yeah, I feel like maybe if there's a way that, I mean, California has our own, maybe compared to most of the states, there's certain things that might be different. So I don't know. My suggestion is, you know, if they're maybe even presenting, hey, these might be some of the major differences to look at. I mean, I know you can just say, look at the whole thing, you know, look at what are the standards, the scope of practice, but if there might be ways of highlighting just so that we can kind of point it out, that these might be some differences that we have in California versus some other places, so that maybe versus like waiting till the emergency comes and everyone's, okay, I'll just do it, and then trying to help, they end up doing something that they're not aware of. So I think the intention is to help, but maybe letting that be known beforehand so it's maybe less of a problem if it is. So.
I have another comment, but I want to open it up to others first. Sorry. So I guess another thought, I guess I'm having, maybe a half thought perhaps, is concerns that are maybe a little bit parallel to the reasons that the Compact Acts have not been supported, which is, I think, one of the primary concerns that I think this board has raised, has been the difference between scope and an ethical obligation, especially if we're inviting other practitioners from other states to practice here. So the attestation looks like it's only limited to scope, but I don't see any other sort of component that would require or suggest that there's also an ethical understanding of the California law and ethics specifically. And I'm wondering if that might be something that could be included, some language around that. Any other thoughts?
So I guess the question is, I'm sorry, Kelly, were you going to say something? Okay. So Nick, what did you need from the board?
So I was thinking, I was curious if we can include that suggestion, if that's a possibility, to include to expand basically the attestation, if that's going to be the model that's going to be used to both the registration and attestation for scope.
And so it's expanded to that they're aware of the applicable California scope of practice and California law and ethics.
Correct.
Okay.
So with that, do we have a motion for this first bill?
Why don't you just let me know if what actual stance you want to take, and then I'll read the motion as we need to have it.
Understood. So I would suggest that we don't take a position. That would be my recommendation.
So no position, and just direct staff to reach out with technical feedback to
Correct.
the authors. Okay.
Yeah.
Yeah, but so that would be the motion, is direct staff not to take a position, but to reach out to the author's office with the concerns regarding item 5, Government Code 8599.57A, item 6, Government Code 8599.57E, and then also
Roseanne, we don't need a motion for that.
no, to read, okay.
No.
Okay, never mind then.
Sorry, I didn't want you to get too far in.
Okay, that's better, less words.
Yeah. You do have to still go out.
We need to go to public discussion though.
Right, public comment. There's no motion. And then you move on to the next one. Yeah. No motion.
Okay, are there any public comments for those in the audience? Seeing none, is there any comments, moderator, for those online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, press *3 to raise your hand. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment. I return the floor back to you.
Thank you, moderator. I'll turn it back to Roseanne.
All right, so we will move on to AB 1988. And so I think I'll just say up front that the Policy and Advocacy Committee recommended position was support. So if the board chooses to go that direction, the motion would be to support AB 1988 and to delegate authority to the board chair with the assistance of the executive officer to modify the board's position in response to any subsequent amendments to the bill. So that would be the motion on the table. The bill improves safety protocols for companion chatbots by requiring operators to establish policies for detecting credible crisis expressions, issue warnings, and initiate a mandatory crisis interruption pause after 2 credible crisis expressions within 72 hours, including directing users to the 988 Suicide and Crisis Lifeline. So the legislature started working on some amendments or some law related to chatbots last year, and this kind of expands upon that effort. In this particular bill, it requires the chatbot operators to implement a monitoring system for crisis expressions. When a crisis expression is detected, it needs to do several very specific things. For the first one, it warns that there will be a crisis interruption pause if another one happens. The conversation would be suspended, and then the warning needs to acknowledge the person's distress in non-judgmental language, encourage them to seek immediate support, human support, and that many people feel relief after a short conversation with a trained crisis counselor. The contact information for the 988 Suicide Crisis Lifeline must also be prominently displayed. And then for the second crisis expression, that actually triggers a crisis interruption pause, acknowledging the distress non-judgmentally. In contact information for the 988 Suicide Crisis Lifeline must be displayed again, and it must inform the user that the pause will continue until a human moderator has reviewed the chat and determined an appropriate course of action in accordance with the operator's policy. And then the crisis interruption pause is not terminated until a human moderator has reviewed the crisis expression and determined the appropriate course of action. And they cannot describe the crisis interruption as a punishment, violation, enforcement action, and it prohibits them from providing the user with any diagnosis, labeling, or assessment. And so in the Policy and Advocacy Committee discussion, the committee recommended a support position on the bill, but separate from the position, the committee also asked staff to reach out to the author's office with a few different concerns and feedback. So the staff has reached out regarding the following 3 things. There was concerns that the bill defines a human moderator as the person who reviews a credible crisis expression and determines the course of action, but it does not specify qualifications or required training. For example, have they had suicide crisis response or 998 informed practices? And so we asked if the author would be open to adding minimum training requirements, such as suicide crisis response training for the moderators. We also the committee had questions regarding the basis for the 72-hour window. It triggers a crisis interruption pause upon a second crisis expression within 72 hours. So the committee was curious the reasoning or evidence based for the choosing the 72-hour interval. Is there clinical research or some sort of a data that they base that on? And then also the bill requires the pause continue until a human moderator reviews the crisis expression, but it does not set a maximum time frame or expectation for that review. So would the author consider specifying a time limit to ensure prompt attention and reduce user risk? So those are the three things that we reached out to the author's office about. Have not heard a response yet. That's not necessarily unusual. While the bills are moving through committee, they'll take that feedback at some point, especially if the board takes a formal position. And so I will open it up for comment.
Any comments from the board? Kelly?
So, I was one of the people in policy and advocacy who supported this bill, and I still do. It is a much needed bill which doesn't go far enough and it's not really clarified enough, but it's needed because it's such an exigent issue right now. And there have already been documented cases of children who have engaged with a chat box only to find that chat box leads them into psychosis or suicide. I'm still not a fan, and I think this was Board Member Sovek's comment in the Policy and Advocacy Committee, if I remember, of the human moderator, who is defined as, in the statute, a natural person that is an employee or agent of the operator who reviews a credible crisis expression and is responsible for determining the subsequent cause of action on behalf of the operator. Well, that's great. That's exactly who it is, but you want someone who has some training in crisis response to be reviewing these very contextual discussions. You don't want like some guy just saying, well, here's the suicide hotline, here you go. I'm going to shut down your chat box now for 72 hours, but I'll see you in 72 hours. So I think that's an area that needs to be addressed, but at the same point, and you can sort of see from the history of the bill, when it began as a very specific sort of aggressive bill, it's sort of been watered down a little bit. How it's sort of taken on this pall, which really makes things a little bit easier for the corporation and the operator of the chatbot itself. But ultimately, we need some legislation in this area, and we need some regulations affecting how companies deal with these very dangerous devices and bots that are really catered to children and vulnerable people anyway. So from my perspective, I support the bill.
Yes. Thank you, Kelly. Go ahead.
Yeah, so I'm also more in favor of the human person, a therapist or someone well trained, but I know they're trying to supplement it by putting this 988 number. I would say, if they even put that at different times or even had to verbalize, because there might be some people who can't read or may not totally, may not even pay attention. They might just skip through it. But I would just say that maybe it should at least be read, and shared different times throughout.
Thank you. Any other comments? Any comments from the public in the room? Oh, sorry. Do we have a motion to
Support, as Roseanne read.
So I had done the motion, read the motion of support. You can change the motion if you want to change it to support if amended or oppose unless amended, or you can do support and direct me to, reach out again to reiterate the already provided concerns and just say the full board stands behind these. That's your call, what you're comfortable moving forward with.
So the motion currently was the recommendation of support.
Of
correct?
support, yes.
Okay, so that's the motion that we currently have.
Support and delegate to the board chair if there's any changes.
Okay. Is there a second on that motion?
I'll second it. Hey, Reby.
Oh, I guess somebody has to make the motion, correct?
Oh.
So somebody has to make the motion and then we have to have a second on that.
I'll make the motion that we support the bill and ask nicely, Roxanne, to speak with the formulators of the bill about strongly suggesting that we have someone qualified, or at least at the very minimum trained in crisis intervention, to review the discussion itself, and that the human operator provision of the bill have a section in there related to qualifications.
Is there a second?
Second, Dr. Walker, public member.
Are there any other comments from the board?
And I believe we're also including the changes that were Roxanne had.
So
mentioned.
yeah, so the motion is support, but then it would be the three, we would respectfully request, but the position's not contingent on it, that, we had the 3 items of feedback, and I'll strengthen the board really strongly had some concerns about the qualifications of the human moderator, and really believes that their qualifications should be outlined better and require some training in crisis intervention.
And that also includes the other comments brought up in P&A. You'll still be pursuing those as well?
Yes, the 72-hour window basis, and then the time limit for the moderator review. Yes, it will be those 3 bullet points. I'll just beef up the human moderator language a little bit in my discussion.
Thank you.
I know there's confidentiality, but sometimes, like if somebody were to say, hey, I'm going to be killing myself, a part of me almost feels like if there was an optional, like, hey, you can put your, because when you're talking to, somebody in therapy, somebody will say, hey, where are you located? But I'm just saying maybe there could be an option of putting where you live or something, but I'm just.
Thank you. Any other thoughts? Okay. Any comments from the public audience here? Moderator, any comments from those online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, press *3 to raise your hand. We are displaying instructions and we'll give you a moment. This is the moderator. I see no request for comment. I return the floor back to you.
Thank you, moderator. We'll move on to number 3 and we'll turn it back to Roseanne.
We need to.
Oh, sorry. Take a vote. Sorry. Raquel, thank you.
Kelly Ranasinghe,
Yes.
Dr. Annette Walker,
Yes.
Eleanor Uribe,
Yes.
John Sovek,
Yes.
Susan Friedman,
Yes.
Dr. Nicholas Boyd.
Yes.
Motion carries.
Okay, now back to Roseanne.
All right, moving on to AB 1979. We kind of grouped most of the AI bills here together in the beginning because they're kind of interrelated. So you'll notice that when we talk about these next 2. So AB 1979 by Assemblymember Bonta has to do with healthcare services and artificial intelligence. And the Policy and Advocacy Committee, a lot was going on with this bill at the time of the committee. It's actually been amended since then. So the P&A committee did not recommend a position on this particular bill. But what it does is it requires health facilities and medical offices to make sure no clinical decision is based solely on the output of a clinical decision support system, and requires them to ensure licensed healthcare professionals utilizing these systems exercise independent professional judgment. It also bans the use of AI to direct, guide, or instruct unlicensed staff in performing any functions that require a professional license. So, in terms of specifically what this bill is doing, it basically does what I just said, but it defines a clinical decision as some very specific tasks. Basically, that includes assessment of a patient condition, education of the patient family concerning healthcare problems, post-discharge care, communications between licensees regarding patient handoff, and other documentation and communication that requires a licensee's professional expertise as it pertains to their patient's health. It specifies that using AI for documentation and communication that does not involve professional judgment, such as automated messages to inform patients of updates to their health records, is not prohibited. And it specifies that penalties that apply for violations, including that a licensing board may pursue an injunction or restraining order for unlicensed practice. So in terms of this bill, it has a lot of support and a lot of opposition. Just in terms of, to give you both sides, the supporters, support for obvious reasons that, AI is becoming more of a concern in patient health care. And while the whole technology holds a lot of promise, they say, they cite the risks to patient safety and trust and, having human eyes on healthcare. The opponents tend to argue, and you kind of see the themes with a lot of the AI bills we're going to talk about today, is that the bill is too broad, prohibiting AI assistance in activities like patient assessment and clinical documentation, even under supervision. And they tend to argue, and this tends, I think, to be more for doctors and like radiologists that are using AI assistance. Is kind of some of the arguments I saw, that the tools are already in use and over-regulating them would discourage their use, eliminate their utility, and undermine efficiency gains. And again, I think that's because we're talking about healthcare as a wide net. This particular bill applies to healing arts professionals, not therapists specifically, but it would apply to therapists, but as a part of a wider umbrella. I don't know whether the most recent amendments affected their position. We won't know until the bill goes to its next policy committee to see if they've removed their opposition. But I want to compare this bill a little bit with the bill that we're going to be discussing next, SB 903, because I think that discussion is needed to see how these bills, or to discuss how these bills would be compatible, or if these bills are compatible with each other. So I'm going to touch a little bit on the SB 903, even though we're going to talk about that in a minute. So this particular bill is sort of a broader umbrella for healthcare professionals. Prohibiting the AI from using AI as this sole basis for a clinical decision. They need to ensure that licensed healthcare practitioners are using their independent professional judgment in making decisions. So that's sort of the wide umbrella. SB 903 is specifically focusing on the use of AI in delivering psychotherapy services, prohibiting an individual, corporation, or entity from providing, advertising, or offering psychotherapy via AI unless the services are conducted by a licensed professional. It allows licensed professionals offering therapy to use AI for administrative or supplementary support, which have very specific definitions we'll talk about in a minute. It prohibits psychotherapy communications or sessions from being recorded or transcribed unless there's consent, and it prohibits anyone from using AI to make independent therapeutic decisions, or recommendations, or diagnoses, detect emotional or mental states, or assess urgency of symptoms. Staff had concerns previously that previous versions of this bill, AB 1979, were overly broad and may overlap and have compatibility issues with SB 903. Because SB 903 allows some professional use of AI in psychotherapy with client consent. I think that the most recent amendments of this particular bill appear to address the compatibility concerns. The previous version of AB 1979 banned the use of AI completely to replace any professional judgment of a licensee without specifically defining what that professional judgment entailed. So I had a concern that while SB 903 allowed it for some administrative and supplementary support. This bill kind of contradicted that by completely banning it at all, its use at all. But the most recent amendments still appear to permit the use of AI, but do not allow it to be the sole basis of a clinical decision, and require the licensees or exercising independent professional judgment. So we can have a discussion if you would like about whether any compatibility concerns remain. I'm seeing it, my non-clinician opinion is they seem fairly compatible now, but that is subject to further discussion if you would like. So with that, I will open it up for more discussion and comment.
Are there any comments from the board?
Roseanne, does it look like the possibility that 1979 and 903 will be merged at all?
I don't think that they will be merged because 1979 applies to all healthcare practitioners, where 903 is meant to specifically address psychotherapists. But I think that they are now being more mindful moving forward. I think that the first sort of both bills were thrown out there along with a bunch of other AI bills. I think that they are now actively working. Maybe Shanti can speak to this because they're CAMP is sponsoring SB 903. But I think that they're more actively working to make sure that they're compatible now that the discussions have sort of started regarding the bills. There's a lot to discuss, a lot of different angles, from a lot of different people. That's why I expect that these bills over the summer will change many times.
Susan?
Yeah, Roseanne, I just have a question. Do any of these bills address specifically some of these online therapy centers that advertise, on the radio and television?
So they specifically address AI. So if they're using AI, then yes, it applies regardless of the venue or the platform being used.
But none of them are interested in the platform specifically. They're just talking about therapists in general.
They're talking about the provision of psychotherapy in general. Yes.
Any other comments? Comments from the audience?
Is there going to be a motion? But I think you need to ask whether we're changing the position.
Apologies. Would somebody like to make a motion on this particular item?
Seeing none, you can go to
Seeing none? Okay.
Well, Board Chair, Dr. Annette Walker, Public Member, just to clarify, the P&A, Policy and Advocacy Committee, their stance is to support if amended? Or did they make none?
They actually didn't recommend a position. When they looked at it, it was more of the old version, which really wasn't compatible with 903 that we're about to discuss, but they didn't.
Okay.
We knew that it was going to evolve further at that time.
I agree. And thank you for clarifying that.
So John Toback, LMFT, I'd like to make a motion of support for AB 1979.
Can I add to that, John?
Yes.
With the standard language we have, because this is one that this is basically for this and the next bills, we know it's going to change. So support and to delegate the authority to the board chair with the assistance of the executive officer to modify the board's position in response to any subsequent amendments to the bill.
Yes, I so move.
Okay, thanks.
Do we have a second?
I'll second.
Too late.
Are there any other comments from the board on the motion, John?
So just a quick comment. I think support's important because currently legislation is about 5 years behind what's actually happening in the industry. And this is a lot of catch up that's happening right now. And if we don't start some kind of motion, more consumers are going to be put in places of risk.
And I will bring this back if it's still alive in August, which I would imagine it probably will be. So that the board will have a chance to at least take a position on it for when it goes to the governor. Because bills will be going to the governor at the end of August. And we meet on I think the 13th or 14th.
Okay. Any other comments from the board? Comments from the public? Seeing none in the room, moderator, any comments from those online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, press *3. We are displaying instructions and we'll give you a moment. I see no requests for comment. I return the floor back to you.
Thank you. So I think we'll go through item number 4, D, and then we'll take lunch after that.
Okay, we do need a vote.
Oh, sorry.
That's all
We'll do a vote
Okay.
first. Thank you.
Thank
I'll get it before we're done. I promise. Thank you, Raquel.
Eleanor Uribe,
Yes.
Dr. Nicholas Boyd,
Yes.
Susan Friedman,
Yes.
John Sovic,
Yes.
Dr. Annette Walker,
Yes.
Kelly Ranasinghe.
Yes.
Motion carries.
All right. Thank you.
All right, so moving on to SB 903, and as I mentioned earlier, SB 903 really sort of goes hand in hand with AB 1979. The topic is pretty much the same, and the Policy and Advocacy Committee at its April 7th meeting recommended a support if amended on this bill, and it has not changed since, it has not been amended since that time. So basically, this bill does a number of things regarding the use of AI when delivering psychotherapy services. It prohibits an individual, corporation, or entity from providing, advertising, or offering psychotherapy, including via AI, unless conducted by a licensed professional. It allows licensed professionals offering therapy to use AI for administrative or supplementary support. It prohibits any psychotherapy communications or sessions from being recorded or transcribed unless very specific consent requirements are met. And it prohibits anyone from using AI to make independent therapeutic decisions, generating recommendations or diagnoses, detecting emotions or mental states, or assessing symptom urgency. And I'm going to just note that, let's see, and never mind on that. So basically, existing law provides that DCA boards can take action for unlicensed practice in a violation of any of their practice acts, as we all know. And then the law last year was the first attempt that we saw to address AI in healthcare. And that particular law last year made violating requirements in law that prohibit use of specific terms, letters, or phrases to imply having a license or certificate to practice a health profession without actually having one is a violation of law. If they basically against the person or entity, company that deploys or develops an AI system, and violations are subject to the jurisdiction of the licensing board. So basically, last year the law was changed to say that we, the board, can take action against a company if it's putting a system out there that's saying that it's a licensee of our board. So this particular bill, there's a lot of release of specific things in here. I'm not gonna read it all to you because it would take a long time. I'm just gonna kind of go over some key points. The purposes of this bill is to protect consumers seeking therapy from the increasing use of unregulated AI systems. A number of states are starting to address this. Illinois was the first one last year. In August, Illinois signed a bill this bill is kind of modeled after the original version was almost exactly modeled after Illinois. This one's kind of evolved a little bit to look a little bit different than Illinois' bill. Pennsylvania and Florida are also pursuing legislation this year on the topic, and Nevada signed a law last year regarding this same topic. In terms of complaints to the board, our enforcement unit reports that they have started to have a few complaints related to the use of AI therapy. They had a case where a therapist, there was a complaint, a therapist was using AI to write therapy notes where the complainant had opted not to consent to that use. There was a complaint about a therapist accidentally pasting a client's personal identifying information into AI. And we had a complaint about a therapist using AI to guide client interactions during a session. So it's definitely starting to happen. In terms of the fiscal impact to this bill, due to the increasing reliance on AI, we believe this bill could possibly increase licensee-related complaints by about 5%, which would work out to about 150 complaints a year. So in response, the board is asking for one permanent half-time analyst to assist with the increased workload from this bill. There's also another fiscal component that I'm going to raise more into my technical considerations in a minute, but it has fiscal implications. The bill contains language that would hold an employer or contracting entity responsible if they require or authorize their employees to utilize AI in a manner that's not compliant. It's unclear who would have jurisdiction or over the employees or the resources needed for this type of enforcement case. And in the cases of non-licensed specific cases involving the use of AI to conduct psychotherapy. So the bill states violations are subject to quote unquote the appropriate licensing board, but we could have an instance where a chatbot or something similar is providing services without, they're just saying I'm providing psychotherapy. They're not saying I'm providing marriage and family therapy. So it would be unclear whether the violations would fall under the purview of the medical board, psychology, this board, the nursing board, things like that. And these cases against companies could be very expensive. And so that is something that probably should be spelled out a little bit more. So we can't really anticipate that workload due to the lack of clarity at this time. So that's just something to point out. Now I'm going to go into the other technical considerations, which there are quite a few of. And I've already relayed a lot of these to the author's office, and they have expressed very good faith in wanting to work through all of these to make the bill as good as, the best possible version it can. But these are some of the things that have been raised. The bill uses Evidence Code Section 1010 to define a licensed professional. However, Evidence Code 1010 does not include the board's LEP license types or social work interns. So staff believes that these professional categories also should be included. We have raised to the point that that there is a definition of religious counseling in this bill that it defines religious counseling and so that it is carved out. We are also pursuing a definition of what we are calling faith-based counseling this year in AB 1598, which is our board-sponsored bill that has very specific language. And so we would like, it would probably in best case scenario, it would be nice if that same language was used. However, this act applies to numerous licensing boards and not just this board. So it may be reasonable for the definition to vary, but the board, we're not exactly sure if the differing definitions would cause any clarity concerns or affect the board's practice exemption. So it's not something that we could really change at this point because that definition was very carefully crafted for us in order to define what's allowed for faith-based practice, but this board has a little bit of a different definition. In terms of the definition of supplementary support, part of the definition about supplementary supports talks about that supplementary support includes analyzing and anonymous data to track client progress or identify trends subject to review by a licensed professional. We think it might be clearer to require it to be reviewed by a licensed professional rather than the more wishy-washy sort of subject to review term. And staff questions whether all 4 tasks listed under supplementary support should be required to be reviewed by a licensed professional instead of just one task. In terms of, and this is kind of a complicated one that was made the bill a little bit, not a little bit, really difficult to read and understand, which if I had, my concern is that if I had trouble understanding it, a licensee trying to comply with this might have trouble understanding it. And the problem lies with the use of the definition. The bill defines the term use of artificial intelligence. So, and in that definition of use of artificial intelligence, it includes administrative support and supplementary support, which are defined in the definitions. And then it prohibits the use of an artificial intelligence in providing therapy services unless conducted by a licensed professional. So that statement, by permitting the use of artificial intelligence only by a licensed person, indirectly permits a licensee to use AI for administrative or supplemental support. But the bill never specifically states this. It's only implied by the definition of use of artificial intelligence. You would have to infer back to the definitions that the use of artificial intelligence permits you to do the administrative or supplemental support. So it's only really clear by reading the definitions. I think that the structure is a little too subtle, and it depends too much on cross-referencing. It might be more helpful for the bill to explicitly state or list the permitted and non-permitted uses of AI for licensed professionals in one section, and then separately state the permitted and non-permitted uses of AI for non-licensed individuals, corporations, or entities in another section. That might be, then you wouldn't have to maybe have a law degree, in my opinion, which I don't have, to figure it out. Then another concern, it was unclear, and this again goes back to the definitions again. It prohibits the use of AI to record or transcribe psychotherapeutic communications unless the patient is informed about the use of AI and gives consent. That's the only place where the bill discusses consent. It does not clearly address whether consent is also required if the licensee is using AI for administrative or supplementary support, and that's not explicitly stated. It's possible that since subdivision A there uses the term use of artificial intelligence, which includes administrative and supplemental support, that consent is required, but it's not easily discernible. And so it should be stated more clearly. And then again, there's the jurisdiction ambiguity that I talked about, is if it's a more general psychotherapy use, which licensing board would have jurisdiction and pursue that complaint. And then also at the Policy and Advocacy Committee, the Policy Advocacy Committee discussed that consent should be given in writing, not just verbally, and requested that the allowance for verbal consent be removed and only be in writing. So, at the Policy and Advocacy Committee meeting in April, staff recommended a support if amended position and directed staff to provide all of the feedback that I just provided, plus the new one, about giving consent in writing, not just verbally. So we have relayed that. We relayed that shortly after the meeting. So that's where we are now. There's a lot there. We'll open it up for comment.
Any comments from the board?
Well, just a comment. Dr. Annette Walker, public member. I'm glad we're having the discussion. I mean, not just in this boardroom, but at the state level. So Roseanne, thank you for your work on this. I'll just leave my comment there. And I would make a motion, but unless someone else has something to say.
No, I was just going to say, I agree with some of those things mentioned, and especially it being in writing. And if we can carry over some of that from the former assembly bill, that one about talking, maybe there could be a consent, I consent that to use this thing.
Yeah, I think that the bill does require, right now it says that it can be either verbally or written. I think that our request is just that we take out the verbally and it would be a written consent.
Yeah, and clear, understandable, like this is what you're doing, so, yeah.
I'm sorry, Kelly. I did see your hand raised quite a while ago. Forgive me.
No, it's all right. I was just going to say that ultimately, my comments on 903 are that therapy should be provided by a human, not any form of platform or artificial intelligence. And there are platforms that both advertise. Thankfully, they're not at least advertised in California at present, but there are platforms which advertise AI therapy and artificial intelligence mental health support. And that's, catastrophically dangerous to someone who is in a vulnerable position or has suicidal ideation. So ultimately, the intent of the bill is well-founded, and I support it. So.
I did have maybe more of a question. So for this bill in particular, I believe the psychotherapy is explicit in terms of its use. For those things that are psychotherapy adjacent, meaning for example, there's a number of platforms that promote psychotherapeutic skill building, right? That one could argue and suggest fall within the realm of psychotherapy. A lot of these CBT-based platforms that exist that market themselves as not doing therapy, working in conjunction perhaps with a therapist, which I could see value in that, particularly if you're trying to reinforce and promote outside building what you've done in session. I think there's good reason for that. But I guess my comment / question is, it does seem a little ambiguous where that would fall within the realm of the definition of psychotherapy as it's written. Does that make sense?
It makes sense, and I agree. Right now, if somebody asked me that question, I would point to the definition of psychotherapy and say it depends on if it does that or not.
So with that, I don't know if there's any other thoughts, John?
I'd like to move to take a support position with Roseanne's amazing extra language that will assist us in staying relevant on this bill. If you could read that for me.
Okay. So the motion would be to take a support if amended, and to delegate authority to the board chair with the assistance of the executive officer to modify the board's position in response to any subsequent amendments to the bill. And the amendments would be the items, the technical considerations on page 28D-9, technical considerations A through G of the bill analysis.
I so move.
Second.
Any other comments from the board? Any other comments from the public?
Hello, Shanti Ezrin with CAMPT. I just wanted to start by sharing that CAMPT is co-sponsoring this bill with the California Psychological Association, the California Behavioral Health Association, as well as the National Union of Healthcare Workers. Just really quickly about this bill at its core, like you've covered in great detail, Roseanne, the bill protects patients from unregulated AI therapy, safeguards privacy, and maintains clinical responsibility and accountability with human providers. Just wanted to thank you, Roseanne, for the review again of the bill, and also for highlighting the technical concerns, considerations, as well as the additional one that we heard today. Our team is engaged in ongoing discussions with multiple stakeholders and certainly have these technical considerations noted, as you've already covered. Just wanted to thank you again for the engagement on this bill. I'm happy to take back the additional feedback that I heard today to our team and would really greatly appreciate the board support. Thank you.
Nick, I have a question before we move on about the concern that you brought up, and if you wanted to include that, and if so, how best to articulate it.
That's a great question. I would like to include it. How to best articulate it. I think there just needs to be more specificity in what the definition of psychotherapy is, with also exemptions from that. So, what would be exempt from that definition? Should it be more focused on skill building, and would skill building qualify? I mean, I think it does. I think you could say that's outside the realm of the overall psychotherapeutic in-session process, but I just think there needs to be some type of specificity to what is and what is not considered psychotherapy. I think that would, off the top of my head, is the best I could come up with, but I might even lean on Shanti a little bit in camp to help maybe with that if they understand kind of what I'm getting at.
Would it be accurate for me to use an example of like an app that does CBT, skill building?
I think that's a great example because that's the most common type of AI application out there and there's a number of them that promote themselves as not being the therapist replacement, but being therapy adjacent or supportive of what's happening in therapy. And there's use for that, but I just think there needs to be more clear definitions around what that is and what that is not.
Roseanne, could I offer a thought? So offering psychotherapy and psychotherapeutic equivalent services. So we're looking at the equivalency of providing psychotherapy. And I know legally there are probably all kinds of definitions you would play with in there, but that might be a starting point. Also, the other resource might be going back into the advertising regs and looking at definitions that we've already established there that I think might be able to come across to suggest to the authors.
In the advertising regs.
And there's definitions of psychotherapy that we use in those regs.
Yes.
So there might be something in that language that might help too.
Okay, so we will add that to the motion. So basically, item 7 in the analysis plus the concern that Nick raised about more specificity of psychotherapy with exemptions such as skill building. What would that qualify as? And then looking at psychotherapy versus psychotherapy equivalent services.
Yeah, thank you for that. So I think need to go to public comment online, correct? Yes.
Oh, we're here. We're still here.
Oh, we have one more. I'm so
Yes.
sorry. You're right in front of me too. Yes, thank you.
Bindu Makamla with the NASW California. We strongly support SB 903 and its effort to establish clear safeguards for the use of artificial intelligence in behavioral and mental health care. While AI might assist with administrative functions, it cannot replace the clinical judgment, ethical responsibility, and human connection provided by licensed mental health professionals. We do also want to note that NASW California has also proposed amendments to the author's office to include Master of Social Work students who are practicum students completing supervised internship requirements in clinical settings, and registered professionals alongside licensed professionals to appropriately account for associate clinical social workers. Thank you.
Thank you. Any other public comments for those in the room? Not seeing any. Moderator, do we have any comments online?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or if you've called in, you can press *3. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment. I return the floor back to you.
Great. I believe we are ready for a vote, Raquel.
Dr. Nicholas Boyd.
Yes.
Sorry, I got lost. Susan Friedman.
Yes.
John Sovic.
Yes.
Eleanor Uribe.
Yes.
Dr. Annette Walker. Kelly Ranasinghe.
Yes.
Motion carries.
Great. Thank you again, Roseanne. So I think what we'll do at this time is go ahead and break for lunch. We'll take an hour and plan to come back right at 1 o'clock and then continue with the rest.